All right, well, welcome everyone. It's good to see you all on this beautiful Wednesday. It's a little chilly. Today we have on our agenda, we have a workshop, an executive session, our business meeting, and then another executive session. The last executive session, of course, is just for our school board members. So we're going to be here a little while. And so with that, I'd like to go ahead and get started. So I'll call the meeting to order. And Ms. Tiener, can you please call the roll?
Yes, Kassim.
Here.
Campson. Campson, you're on mute.
Here.
Clanton.
Present.
Gabriel.
Present.
Jordan.
Here.
Smith.
Here.
Martin.
Here. Okay, so first on our list, we have our school board workshop, and Dr. Birdsong's team is going to present the NPS Return to In-Person Learning update.
Thank you, Dr. Martin, and good afternoon, Dr. Martin, Madam Chair, Vice Chairman Jordan, members of the school board, and members of our community. Thank you for the opportunity to share a few thoughts with you this afternoon. The administration is pleased to present an update regarding our proposed plans for returning to in-person instruction for the remainder of the 2020-2021 school year. As you may recall, March 13th will mark 1 year since our schools closed due to the COVID-19 pandemic. With this date fast approaching for 2021, it presents a profound opportunity for reflection on all that we've accomplished to ensure that our students continue to have equitable and positive learning experiences despite these challenging circumstances. I would certainly be remiss if I did not take a moment to once again commend our hardworking teachers, administrators, and staff for all of their hard work and flexibility throughout this challenging time. Yet it has been a time of inspiration that has challenged us even more to make that all-important difference in the lives of the children and families whom we serve. I do recognize that implementing and maintaining this virtual transition has not been an easy task, and I am sincerely grateful for these tremendous efforts. As we consider plans for returning to in-person instruction, please know that we will continue to follow the key health mitigation strategies that have been put in place to protect our workspaces, and your health and your safety remains our top priority. Team NPS, thank you for all that you've done and will continue to do to ensure that each and every child in Norfolk Public Schools is provided a high quality education. I also want to thank our students and families for continuing to adapt and remain flexible as we navigated these uncharted waters together. Early on, none of us would have ever predicted that we would have found ourselves still contending with this horrific pandemic 1 year later. Education has always been a collaborative effort, and our strong partnership with our families has certainly sustained us. The support from our parents, guardians, and community in this journey is truly invaluable. We appreciate the feedback that has been received from those with enlightening perspectives on both sides of this very, very difficult decision. We have heard from many families who are eager to send their children back into classrooms to learn in a more traditional way with hopes of providing some sense of normalcy. Contrary to this, we've also heard from many families who are extremely reluctant to send their children back to school to resume in-person learning due to concerns related to the various unknowns that still exist regarding this virus. Please rest assured that we hear you, and this administration remains committed to making informed decisions that are based on our local health metrics and recommendations from our public health colleagues with whom we have collaborated throughout this process. The health and well-being of our students is paramount. And the administration has continued to monitor local health conditions while planning for students and staff to safely return to school for in-person instruction for the remainder of the 2020-2021 academic school year. This has allowed us to refine proposed plans that will permit the school division to support the unique needs of our community with safely transitioning students, and staff back to school for in-person learning. We hope the information that we share with the board this afternoon will give all of our families some insight into the complexities and myriad of scenarios that the school board must consider in their deliberations. This afternoon, Dr. James Pohl, our Chief Academic Officer, will present a comprehensive overview of the updated proposed plans to begin the phased reentry of our students, to include a snapshot of every facet of their learning experience. Thank you, Madam Chair Martin, Mr. Vice Chairman Jordan, and members of the board. This concludes my remarks for this afternoon's workshop, and I will now turn it over to Dr. Pohl to begin our presentation. Dr. Pohl.
Thank you, Dr. Birdsong. Good afternoon, Chairwoman Martin, Vice Chairman Jordan, members of the board, and Dr. Birdsong. I'm here this afternoon to present updates to the proposed in-person learning plan. In late January, the Virginia Department of Education released an interim guidance document for school reopening. Currently, this is the latest guidance from the VDOE. The document stressed the following recommendations serve as a guide for Virginia schools to use to inform school reopening and closing decisions. Nuanced local public health conditions and practical limitations will be important information to help inform decisions. Although possible, it may be challenging for a school to open for in-person instruction for the first time during times of substantial community transmission or surging case counts, while also minimizing impact to the school community. Divisions should consider the timing of implementation to increase their likelihood of success, and a gradual approach to reopening is encouraged. The document laid out 5 steps to the decision-making process. These 5 steps will guide this afternoon's presentation. Step 1 is focused on mitigation strategy implementation. Step 2 does not pertain to Norfolk Public Schools, as the focus is based off of prior school openings since the start of the pandemic. Step 3 is centered on the level of community transmission. Step 4 focuses on understanding the needs of the community. And finally, Step 5 is designed around how to determine phasing students back to in-person learning. One of the major challenges to this new guidance is the focus, or changes, not challenges, my apologies. One of the major changes to this new guidance is the focus on the core indicators, being the 5 key mitigation strategies. These core indicators specify that schools and school divisions should assess their ability to implement and adhere to the following 5 key mitigation strategies: wearing masks, social distancing, hand washing, disinfecting, and contact tracing. These strategies are most effective when compliance is universal and when all the strategies are used together. Focusing on layered mitigation is imperative to controlling the spread of COVID-19. The following secondary indicators can be used to support the decision-making process in local communities, but should not be used as the main criteria for determining the risk of disease in schools. Percent of new cases per 100,000, percent of occupied hospital beds, percent of COVID-19 hospital patients, and number of outbreaks. Currently, the cases per 100,000 and the percent positivity are being tracked on the NPS webpage, as those were the primary indicators the board voted on for our current return to in-person learning plan. According to new CDC guidance, these metrics should only be tracked over the past 7 days versus our current 14-day tracking. Also noted in this new guidance is that regardless of what the indicators determine, the more students or staff who interact and the longer that interaction lasts, the higher the risk of COVID-19 spread. While risk of introduction and transmission in a school may be lower than when community transmission is lower, the risk is dependent upon the implementation of school and community mitigation strategies. Adherence to mitigation strategies in schools and the broader community will reduce the risk of COVID-19 in schools. Notably, when a school carefully plans and prepares, cases of COVID-19 may still occur. Having detailed plans in place for the occurrence of cases in schools can help quickly mitigate the impact and may allow the school to remain open for in-person learning if deemed appropriate in collaboration with the local health department. To ensure readiness for the 5 mitigation strategies, the following items are in place and planned for once students return for in-person learning. Masks will be required for all students and staff while at the bus stop, on the bus, and in school when not eating or drinking. This is also in line with the recently released CDC guidance document for all levels of community transmission. For self-contained classrooms, teachers are being provided with air sanitizers for each room, face shields, gowns, and gloves for each teacher as an additional precaution. Desks in classrooms will be set up at least 6 feet apart, and movement in hallways will be structured to keep students socially distanced. Within the new CDC guidance, physical distancing of at least 6 feet to the greatest extent possible, including the planning of a hybrid schedule, are suggestions for safety. Hand washing and the use of hand sanitizer will be taught to our younger students and encouraged with older students. Areas will be sanitized on a regular basis, and in the case of someone being in contact with a person who has COVID-19 or a student or staff member who's in the building with COVID-19, NPS and the Norfolk Health Department, Public Health, are collaborating to ensure efficient contact tracing. Additionally, plans are in place at each school to have an isolation room for students who are showing symptoms of COVID-19 to remain until they can be picked up from school. Finally, if there's an instance where a classroom, sections of a school, and or an entire school needs to be closed temporarily to control any type of outbreak, the superintendent must have the authority to make this decision and place those students into a virtual learning environment for a set amount of time. Another plan put into place to assist with mitigation strategies is the hybrid plan. Implementing in-person learning under this plan will decrease the number of students in schools and classrooms, which will allow for needed social distancing. Additionally, the Virtual Scholars Academy remains in place for students whose parents or guardians wish for them to continue learning from home, which is an understandable choice for our community to make. During these known times, NPS has a full understanding that parents and guardians may want to keep their students at home for an extended period of time. This slide shows a visual as to what a teacher-student groups may look like. This teacher has 8 House A students and 7 House B students and 5 Virtual Scholar Academy students. There is a total of 20 students on record. On Mondays and Tuesdays, they would be teaching the 8 House A students in person and 12 House B and VSA students via Zoom, which is now called concurrent teaching. While on Thursdays and Fridays, they will teach the 7 House B students in person and the 13 House A and VSA students through Zoom, with all students having asynchronous learning on Wednesdays. On average, across the division, there will be 10 or less students in each classroom at a time. The secondary indicator is focused on community transmission. As seen on this slide, both indicators have seen an overall decline for the past couple of weeks. Under our current return to in-person learning plan, the new cases per 100,000 that is measured has not been in the moderate zone since before June, and the percent positivity rate has not been in the moderate zone since December 2nd, 2020. Additionally, this dashboard is in the process of being updated based on the new CDC guidance with the color coding and tracking for 7 days versus 14 days. This slide shows the indicators and thresholds communicated in the recently published CDC guidelines. As seen, low transmission is now blue, while moderate remains yellow, substantial is orange, and high remains red. The CDC recommends the use of 2 measures of community burden to determine the level of risk of transmission: total number of new cases per 100,000 persons in the past 7 days, and percentage of nucleic acid amplification tests, including RT-PCR or real-time reverse transcription polymerase chain reaction tests that are positive during the last 7 days. The 2 measures of community burden should be used to assess the incidence and spread of COVID-19 in the surrounding community and not in the schools themselves. Currently, Norfolk is in the high transition area for both indicators. Division leadership continues to work with local public health officials to assess the level of risk in the community and the likelihood of a case in a school facility, the likelihood that a case would lead to an outbreak, and the consequences of in-school transmission. As a precaution, NPS has been collaborating with the Norfolk Department of Health to ensure all employees who wish to be vaccinated are vaccinated as quickly as possible, which is also a recommendation in the new CDC guidance. Approximately 2,250 employees were vaccinated at the February 1st through 3rd event held at Military Circle Mall. There are about 1,000 staff members remaining who indicated on the first survey or have since indicated that they wish to have the vaccination. Last week, there was an additional email sent directed only to those employees who did not respond to the initial email requesting information around each employee's desire to be vaccinated. We're currently compiling and collecting data from the latest survey to make sure all staff members have the opportunity to be vaccinated. Step 4 is focused around balancing the goal of disease prevention and the goal of providing in-person instruction. Divisions should develop a plan to bring kids back to school and maintain in-person learning, most especially for the youngest learners, students with disabilities, students who do not have access to the internet or other services, English learners, and other populations who need it most. Consider when schooling from home is feasible for these populations and make a plan for providing support services for those who do not have it. Division should also consider other aspects of students' risk and well-being that arise when schools do not reopen for in-person classes. Regardless of operational status, division should provide remote options for students and staff who are at higher risk for COVID-19, as defined by the CDC. As the board is aware, NPS has been able to support our learners with needed technology and internet access for at-home learning. NPS has collaborated with community partners for additional childcare opportunities, continued to provide breakfast and lunch to students with over 2 million meals served since the shutdown, and a survey is slated to be sent out this week to all staff around returning to in-person work or if there are needed accommodations if they may be in a high-risk category. Returning to in-person learning under the hybrid model will most likely continue to require a need for some families to have low-cost opportunities for childcare. NPS is continuing to work with providers across the city to have seats for students who may need childcare on Mondays through Wednesdays or on Wednesdays through Fridays. As has been done so far this year, NPS will collaborate with providers to assist with students being engaged in learning. Currently, NPS is partnering with Champions, Boys and Girls Clubs of the Southeast Virginia and South Side, YMCA and the YWCA spread across Little Creek, Richard Bowling, Southside STEM, Taylor, Larchmont, Willard, Larrymore, Ocean View, and Mary Calcott elementary schools. This chart shows the student numbers for the Virtual Scholars Academy, or VSA students, and non-VSA students. The fall numbers were taken at the beginning of the school year, and the spring numbers on the chart are from February 9th, 2021. There was a slight drop in VSA enrollment from the first to second semester. The division will again be sending information to all parents and guardians of non-VSA students to ensure they are aware this is still an option for their children to enroll in the VSA program. However, once they are enrolled, VSA students must be enrolled for the remainder of the school year. And for those who wish to enroll in VSA, they simply have to notify their building's principal. Step 5 focuses on how and when to phase students back to in-person learning. This slide has the decision matrix from the interim guidance document from the VDOE, which is the most current information from the VDOE. Here we see, with Norfolk being in the highest level of community transmission and having the 5 mitigation strategies in place, our priority learners should be in person and groups should be added as capacity allows. As our metrics seem to be on a decline as they fall from the high transmission level to the substantial transmission level, the consideration for maximum in-person learning is suggested, as all mitigation strategies will continue to be applied. As noted in the new CDC guidance, there are health equity considerations that need to be made as well. Longstanding systematic health and social inequities have put many racial and ethnic minority groups at increased risk of getting sick and dying from COVID-19. People who identify as American Indian, Alaska Native, Black, and Hispanic are disproportionately affected by COVID-19, and these disparities have also emerged among children. This slide has the CDC recommended learning modes for schools that follow the 5 mitigation strategies and that refer symptomatic students, teachers, and staff for testing. The update offers a few key changes to earlier language, including color-coded charts that divide reopening options into 4 zones: blue, yellow, orange, and red. Districts with low community spread of the coronavirus or moderate transmission are encouraged to consider reopening for full in-person learning with physical distancing of 6 feet or more to the greatest extent possible. Schools in areas with substantial transmission may still consider a limited reopening as long as they can layer multiple safety strategies in the classroom. In hard-hit communities within the high transmission or red zone, elementary schools may consider limited reopening with physical distancing required, but the CDC recommends middle and high schools be virtual only unless mitigation strategies can be met. Additionally, the bottom row shows the CDC guidance for sports and extracurricular activities. This is the current phase-in plan as approved by the board, with factors being moderate or yellow within percent positivity in cases per 100,000. There are 5 phases in this plan to allow time for any possible needs during implementation. There's also a 2 to 3 week time frame between phases being implemented. This plan would take approximately 12 weeks to have all students back to in-person learning. The administration proposes the following phase-in plan. The new CDC guidance emphasizes for health equity considerations for the phased-in approach, as well as to consider schools that serve student populations that are at greater risk for learning loss during virtual instruction should be prioritized for reopening and be provided the needed resources to implement mitigation strategies. In implementing phased mitigation in hybrid learning modes, schools should consider prioritizing in-person instruction for students with disabilities who require special education and related services directly provided in school environments, as well as other students who may benefit from receiving essential instruction in a school setting. With consideration being made from the new CDC guidance, as well as the VDOE interim guidance, the following phases are recommended. March 1st, all teachers and staff return to their work locations. March 15th, students with disabilities in any self-contained learning settings, English learners in level 1 and 2 and some 3 statuses, and pre-K through 5 students begin the hybrid model. This follows the CDC and VDOE guidelines to have high priority learners attending an in-person option. On April 12th, all middle school students not in an earlier phase begin the hybrid in-person schedule, and high school students would begin on April 26th. Consideration of this timeline may be needed based on extenuating circumstances and levels of community transmission. In order to ensure the ability to transport all students to school, ridership on school buses will need to max out at 40 students. Within the latest FAQ from the VDOE, if optimal physical distancing of 6 feet is not possible, schools should implement a combination of face coverings and a minimum of 3 feet of distance between everyone present. As stated earlier, masks are a requirement for everyone. Children who live in the same household may share a seat. Additional mitigation strategies will be to keep windows open for fresh air and sanitizing all seating and high-touch areas between routes. And consideration will be made for asthmatic students, as well as inclement weather with the windows being open. And the drivers will have a supply of masks for when any need may arise. Changes to the stagger times are directly related to our mitigation strategy for sanitizing after each bus route. Drivers will sanitize seats and high-touch areas after each drop-off. It is estimated to take around 10 minutes to sanitize all the seats, entry rails, and the window areas. The additional time between staggers will also allow for a driver to make 2 runs within one stagger if needed to deliver all students to school. The temporary change for Ghent is due to students there riding the bus with ADL students. As a reminder, in order to prepare for a hybrid schedule, several plans have been taking place. Professional development during the first semester had a focus on Canvas, use of Google Documents, Zoom functions, and content session based around the virtual learning environment. These will continue. However, the greater focus will be on student feedback for success and for teaching concurrently to in-person learners and virtual learners at the same time. Asynchronous learners are continued to be created, or learning lessons are continuing to be created in the curriculum and instruction with the instruction team and assistance with teachers from across the division for all teachers to have access to. These lessons align with enhanced pacing. All classrooms have web cameras along with charging power station cords for recharging student devices, and each teacher will have a Bluetooth headset so they can talk with students in the classroom and also be able to speak with them when they're home online. These items have already arrived in the division and are ready to be distributed to our teachers. A return to face-to-face instruction webpage has also been created for additional support. And this webpage has videos of model lessons from our teachers, an introduction video, and will be a repository of resources for our teachers as we begin concurrent instruction with an in-person learning in place. Next slide, please, Ms. Tanner. Although there will be a formal presentation next month about extended summer programs, we wanted to share a brief overview of what is being planned to provide opportunities for all students to address any needs for learning loss from this year. The basic skills program will be extended this summer. Traditionally, the elementary program is 4 weeks. This summer, they will be offered over 6 weeks, and they'll extend beyond core content to include opportunities for choice learning around art, music, physical education, STEM, and other innovative programs. The secondary basic skills program will also be extended through offerings at multiple schools with elective opportunities beyond core content traditionally being offered. Each school has presented plans for creating an innovative learning opportunity for all students to participate in, that also focus on varied skills and will include a focus on core standards to ensure NPS is addressing learning loss at all levels of learners. These will be offered in addition to the division-wide programs offered through STEM, Camp Einstein, Junior University, and other programs. Additionally, there will both be live online and asynchronous online learning options for students to participate in at all levels this summer. Thank you for allowing me to present this information at this time. I'm joined with my colleagues to answer any questions you may have.
Thank you, Dr. Pohl. I see Ms. Campson's hand and Mr. Clanton.
I don't know why I'm having trouble. Okay, got it open. Thank you. Thank you very much for the presentation. I can see how much effort Dr. Birdsong and you and the whole leadership team has put into this planning. Very concise. I really am appreciating it. I do have one question, either for Dr. Pohl or Dr. Birdsong. As time goes on, and you are and you're seeing how things may be changing or hopefully more and more improvement, is there a possibility that you might be open to closing that gap from April 12th to April 26th, I believe, for our senior high schools, so that maybe we could even cut it in half and bring them back just a week after the middle school start rather than 2 weeks? Is that something that you'll be doing, Dr. Birdsong?
So, Mrs. Campson, I think the key word here is flexibility, because we have to continue to monitor our health metrics. And so, take into consideration some logistical matters that we have to contend with daily. So we are certainly very flexible. We would want all of our kids in school right now under ideal conditions. And we know right now it's just not possible. So we will be reviewing this, constantly reviewing this plan. And if we're able to bring more children in, we're happy to do that. And again, flexibility is the key.
Thank you very much. I'm all in for the flexibility part. Thank you.
Mr. Clanton and then Ms. Bassim.
All right, great. Can you hear me? Thank you, Dr. Martin. Okay, I have a series of questions. I'm just going to be precise on these here. Just to kind of fill in some things here. So the plan that I think we have from the fall, and even what you're presenting here now, Dr. Birdsong, it's been developed with the guidance both from the Department of Education and the CDC, correct?
That is correct.
Okay.
We're using the latest guidance from the Virginia Department of Ed provided in January. And as you know, the recent CDC guidelines were provided, I believe it was this past Friday.
Exactly. And so there's 4, as we talked about, there's actually 5. And I guess I wanted to focus on number 4, which talks about, Department of Education talks about the cleaning and sanitation and sanitizing, but it also talks about including ventilation improvements. And when you look at the guidelines that are in there, it says where possible. And so I wanted to give you this opportunity to highlight for not only the board members here, my colleagues, but also for the community, what things have been done to where possible, or what mitigation strategies are in place to improve ventilation at the schools.
And we're happy to do that. And I'm going to ask my colleague, Mr. Fraley, to share some of the things that he and his staff have been working on over the past several months. And we're happy to share all of that information with you. Mr. Fraley, you want to provide a quick update, please?
Yes, ma'am. We've evaluated all 51 schools, a team of our HVAC specialists, and they've evaluated the percentage of clean airflow versus what is referred to as dirty airflow, or air coming in from outside through our dampers. And all of our systems right now are within CDC guidelines. They all have fresh filters, and we are ready to go.
And I guess in some spaces where there'll also be the opportunity to open windows and so forth to let fresh air in and so forth, right?
That is a recommendation. Where we can, we will. Yes, sir. And all schools know that. All head custodians know that. They've shared that with their teams.
Great.
And Mr. Fraley, you may want to add the information about the sanitizing humidifiers that have been purchased for some class. Okay.
Yes, ma'am. We'll do. When we evaluated all 51 schools, we determined that there were classrooms that might need assistance, that weren't equipped to get the fresh air induction we were hoping for. So we purchased sanitizing humidifiers for those classrooms, and they are being installed now. These humidifiers use a very similar chemical to the 360 fogging machines. It's a little less dense. It's 300 parts per million, and it is, approved. And those are being installed now. We're starting with the elementary, and when we're done with those, we'll do middle and high. We're putting those in 757 classrooms across the district.
Great, thank you. Dr. Martin, I just have a couple quick other items here that I wanted to stress. And I think I heard Dr. Pohl mention this about the Virtual Scholars Academy. And so the plan that we have that's being presented here today is an option based on the governor's direction for us to have some type of in-person learning, but there is still an option, and I think that option rests with the parents, if I'm understanding here, if they would like for their child to remain in a virtual environment, that they can do so. Is that correct?
That you're absolutely right, Mr. Clanton. And in fact, again, we acknowledge that many of our families may not want their children to return to school, and we understand that. So we have a robust program, as you're aware, our Virtual Scholars Academy. And, upon the board making a final decision regarding our proposal, we will certainly be in communication with our parents to allow them an opportunity, if they would like their child to now be a part of the Virtual Scholars Program, that we will give them some instructions on how they can do that. We will certainly have that remote option for parents who want to keep their children home.
And my other item following up to that was about vaccination. And so I know that we saw the numbers that were here. I think you said 2,250 of our MPS employees have been vaccinated. There's about 1,000 that are on the list for, I guess, the next phase here. And we've had 3 separate, I guess, events, and we're still reaching out to those who may not have responded. So when it comes to the question of vaccination, is that a requirement for our employees to work?
In accordance with the CDC's guidelines and the Virginia Department of Education's guidelines, vaccinations are not a precursor to children returning to schools for in-person instruction. And thank you for mentioning the data around the numbers. That's the data that we have currently, but you need to know that since the first event that was held for Norfolk Public Schools on February the 1st, the 2nd, and the 3rd, additional staff have been vaccinated between that time and now. We just don't have that data to share with you today. So we have 2,250 plus individuals who have received that first vaccine.
Got it. And just my last one here, Dr. Martin. I don't want to try it, but normally I'm kind of quiet, so I'm taking back. Maxine Waters will say I'm reclaiming some of my time here. So the last thing that I wanted to ask was about the cameras. I've had the opportunity, I've been in visiting some of our schools, and I just want to say thank you to all of our administrators and staff and our janitorial staff. They're doing an awesome job getting our schools prepared. They look awesome. But the question that I have is about the cameras. And I guess I'm going to tee this one back to Dr. Pohl or Dr. Cataldo. In this time that you're projecting here and proposing for teachers to come back on March 1st, where there'll be some professional development in there. I know if I heard about Bluetooth headsets and so forth, to expand upon this virtual learning experience for our teachers and how to utilize these cameras and some best practices to support that effort.
So, Mr. Clanton, yes, that's a part of the concurrent teaching model as well, is how we're using that. And then Dr. Cataldo has the ITRTs all ready to do in-person learning on, the setup of the camera, the setup of the Bluetooth headsets to make sure that everything's running smoothly by the time we're actually doing concurrent learning.
Great, thank you. Thank you, Dr. Martin.
All right, Ms. Bassim, go ahead.
Thank you, Dr. Martin. Dr. Birdsong, I want to thank you and your team for providing us with this detailed in-person learning plan or updated learning plan. I do have a few questions and points, really for some for the administration and some for board discussion, if we could. So there's a couple of things that the school system itself can control, and those are, the infection control measures, the mitigation strategies, and communication and trust, right? And building that, which I know we've been working very hard to do. And so in that respect, I'm glad Mr. Clanton brought up, the ventilation question, which, if he hadn't raised it, I was going to raise it as well. Because while sanitizing buildings is incredibly important, so is the ventilation. And so I'm glad to hear, the efforts that have been made by the experts in our school division to enhance ventilation in our buildings. And so along those lines, as health equity is, an issue and has been outlined in the CDC guidelines, I think as we work to build trust and strengthen the trust in our community, I'm looking, and I've phrased this before, but I guess I'm looking for action from the board to support the posting of those air quality reports. If there is an assessment, what that assessment is, what it looks like, and if we could have a dashboard that is posted along with our health metrics, so that our families and our students, and our teachers and staff can follow along and check the health of their building. And, I've seen some great examples that have been done in other districts, and I'd really like to get board support to ask the administration, as we revamp, the website, to include these details, that we include that piece along with it. And so I'm throwing that back to my colleagues for, some input and discussion. And if there's support for that, I'd really,
Let's pause right there and see. Are there any comments about posting air quality reports in the schools? Mr. Clanton, Mr. Jordan, and then Ms. Smith.
Yeah, so this is something that I actually favor, being transparent. I made notes about that. We get one opportunity to do this well in order to maintain public trust. And so whatever we can, and when we talk about being transparent, this is one of those efforts. My only caution, though, is I just like to ensure whatever we do, that the administration is, very clear as to exactly what we're looking for. Because though it is an important effort, I don't want it to be a cumbersome effort, and making sure that we have places that, things in place that can support that. That's my only thing. Like, I want to do it. I think it's a great thing, but I just want to make sure that it doesn't take away from something else that we need to ensure happens. Mm-hmm. But I would support it.
Okay, thank you, Mr. Clinton. Mr. Jordan?
I was just raising my hand in support.
Okay. Ms. Smith, go ahead.
Same here. I definitely support the concept, and I believe it would give all of our stakeholders, whether it's students, families, teachers, other personnel, it'll give them another level of comfort.
Okay. Anyone else? Dr. Gabriel, go ahead.
I'd like to hear from Dr. Birdsong on her thoughts on the issue.
Okay. Well, but first, is there anyone else from the board that would like to comment? Okay. All right, Dr. Birdsong.
So certainly we want to build the community's confidence and our plans moving forward. And if that is the will of the board, I would like an opportunity to meet with my team to discuss what this could look like.
Absolutely. All right, thank you.
Oh, wait,
the team continue.
Oh, okay, thank you. So, and along those same lines, I think, it's important, and I've received a lot of feedback about this from, teachers, staff, parents and students as well about, whether we would consider having a dashboard that also indicates cases and among staff and students, by school, as many other districts have done as well. And so, I'd like to get board support to do that. And this is all in an effort to, to build trust and confidence in our efforts. And it's also, I think, an internal control for us to really monitor how well our mitigation strategies are hindering, which is our goal, hindering the spread of the virus, and will really tell us, what transmission may look like in a school, going forward. But I would like to see us have that dashboard as well.
Ms. Vestine, I'm sorry, I was trying to write down. Can you can you say that again? So on the dashboard, what kind of data are you asking for?
Cases, the number of cases among students and staff at schools, at each, by schools. So, if a family member or a parent wanted to, check the status of their school, they could see it. The public, the community, can see how our schools are doing.
Okay, we've been, so the administration has been reporting on COVID cases. It just hasn't been in a dashboard format.
Right. So that's what I'm asking for, in a dashboard format, where, someone can go and look at their own school and see what the status is at their school. It wouldn't require, reaching out to a board member or reaching out to somebody in administration. It would just be on a dashboard.
Well, Dr. Birdsong, could you speak more to how you plan to communicate through contact tracing and so forth? So if there's an incident in the school, can you describe that plan?
Sure. So that's definitely, right now it's done more centrally, just based on the number of staff that we have physically in buildings right now. But once we return for in-person instruction, that's going to have to be handled at the building level. So there will be a designee at every building, most likely the building principal, working in collaboration with the school nurse to provide that information to parents and students and such. And so we are certainly, again, I think transparency is a good thing. So if we, need to have by school the number of cases to include students and staff, we're happy to do that.
Okay, great.
But we just need to understand that we will have positive cases.
Yes. Okay. And I think that's understood. Yes, but. Yes. And along those lines, Dr. Birdsong, or any member of your team, so will the health protocols that that we use, will they be updated in an updated health mitigation plan, or are they already on the district's website for parents to view as we get ready to return to school?
So once again, once the board approves, this proposal or a part of the proposal or whatever is decided, we will update our plans accordingly.
Okay, great. And I also have a question about the concurrent teaching. Will the students be required to bring their devices to the classroom, and would they essentially be logging in just like the virtual students and accessing the instruction the same way, so that?
Yes,
So
there is.
And I'll let Dr. Pohl further explain. Yes.
So, Ms. Bassine, yes, we would require students to bring the devices back and forth. One of the hopes is just simply because we're transforming what the classroom looks like, and we would want those to be used intermittently anyway. But we would want all students to have their devices, so a teacher can teach a concept, through Zoom if they had to make it more comfortable as they learn that concurrent teaching process.
Okay, great. Thank you.
You're welcome. Okay, so I think I'm a little off. Mr. Jordan, did you have a comment? Because I have you down next.
I do at some point, as you know, I usually try to go last or before you. So I'm waiting to go last or before you.
Have Ms. Smith, did you get a chance? Where are you? I don't see you. Did you have something to say?
No, I do not.
Okay, then, go ahead, Ms. Ms. Campson, go ahead. You're on mute.
Well, it's only been a year. I don't know why people expect me to learn how to do all this stuff in a year. Another quick question. When we'll have some people that probably still have doctor's notes for staying home because of their susceptibility, and we have teachers that get sick and are out. Is there something, and normally we would have a list of substitutes, but with what they would need to know to be able to do the double teaching and all that, is there something in place to start, trying to rev up the substitutes that we have?
Yes, Mrs. Campson. In fact, there's training already being conducted of our substitute teachers. Mr. Billups and his team have worked very hard with the training, and that training will continue.
All right, so when the schools need them, as this comes up, because even without a pandemic, teachers get sick or have family emergencies and all, we'll be able to, as well as we can. I know we can't, even before we couldn't always get subs. So, but you're going to have some ready to go.
And to your point, Ms. Campson, we do anticipate that there will be substitutes who are on our original list who may not want to enter into our schools for a variety of reasons. So we're not unrealistic there. But you do need to know that we've offered the vaccine to our part-time teachers. So our substitute teachers were on the list to be vaccinated. So hopefully that will help them feel a little more safer about, returning to our schools.
That was a great idea. That was forward thinking. So I know you're doing your best, but just something that I think we want to be sure we keep our eye on is that we're able to staff the classrooms. Thank you very much.
I can assure you that training is taking place, but we will anticipate less teachers, because many teachers will prefer not to go into school buildings for a variety of reasons. Substitute teachers.
Okay, thank you very much.
All right, Dr. Gabriel and then Ms. Basine.
Thank you very much, Dr. Martin. Dr. Birdsong, thank you very much to you and your staff for the presentation this afternoon and putting together a very sensible plan with regards to an accelerated return to in-person learning. There are a couple of questions that I had, and I do appreciate the questions already brought forth by my colleagues. Can you first highlight the various ways of communication that the division is using to inform parents about the decisions that are taking place, how parents should communicate with their principals or their schools, should they have questions or if situations come up? If you could do that, thank you.
Absolutely. That is a wonderful question. We have developed a robust communications plan around our potential return to in-person instruction. And I'd like to give Mrs. Kanita Matthews, our newly appointed Chief Communications and Community Engagement Officer, an opportunity to respond to that. Mrs. Matthews?
Yes, so we do have several things in place that are ready to go. We're preparing a special section on the website and communications that will be disseminated to make sure that everybody is clear and understands on what's our next steps. So been working with the team, and we are going to continue working following tonight's meeting and have everything ready to go to share out on social media, the website, letters to our parents and families and staff, as well as to our friends in the media.
Okay, thank you. And Dr. Birdsong, thank you very much for touching on the child care options as well. I believe that was an important segment that Dr. Pohl touched upon, because if we do move forward with this hybrid plan, there will be families in need of child care options for the days of the asynchronous days and then the days when they are in the virtual setting. And so I appreciate that. And so if families do have questions about that, where should they direct their questions to?
So I would have them direct their questions to their building principals. They can email their building principals. In addition, Mrs. Matthews, as she's working to develop this new webpage for the return to in-person instruction, if the board decides to go in that direction, we will have specific information about childcare options on that website or webpage.
Okay, thank you very much. And you may have touched upon this, but are we still including a before and after care option as well?
Absolutely.
Okay, thank you. I had a couple of questions come up when Mr. Jordan and I were attending the Norfolk Council of PTA meeting the other night, and question came up about, are SOLs still going to take place, and how are they going to be I guess graded, so to speak. And I wanted to make sure that I provided them with an accurate answer. I do know that right now some SOLs are taking place, but as far as school accreditation goes, if you could just kind of talk a little bit about this, because this was a question that came up by a couple of the parents.
Absolutely. So as you know, we will continue to have our children take the standards of learning assessments. However, we will use that information to provide remediation, summer opportunities, enrichment opportunities, and things of that nature. It will be used as another data point. However, the results from the SOL assessments will not be used for the accreditation of schools, because again, accreditation has been waived for this school year based on the pandemic.
Thank you very much.
But that really doesn't have anything to do with the opening of schools or not, because SOLs would happen regardless. Am I correct?
Could you please repeat that, Dr. Martin?
The SOL testing, whether we're having it or not, does not really have anything to do with the going to in-person learning. They would happen virtually.
So we would still continue with our SOL program.
Great. That's what I was just clarifying.
Again, yes.
Go ahead, Dr. Gabriel. Did you have another question?
No, I just want to commend Dr. Birdsong and staff again for taking into consideration the concerns and questions from the teaching staff. I know that they are working tirelessly to deliver education through this virtual platform, and they're as a former school board member used to say, they're driving the car and changing the tire at the same time. And I respect how you all have really focused on the needs of the staff. And now it's time for us to focus, not that we haven't been, but to really provide some of the concerns and suggestions from the families that have also provided feedback to us as well. So thank you. I do not have any other questions.
Okay, thank you.
And to be clear, Dr. Gabriel and Dr. Martin, as it relates to SOL testing, yes, we will continue with testing, but it has to be in person. There will be the administration of SOLs will not be virtual at all. So that still stands.
Thank you.
Okay, just to clarify.
Okay, and Ms. Bassine, if you don't mind, I'd like to go to Ms. Smith, and she hasn't asked as many questions. So, Ms. Smith, go ahead.
Thank you. I just have one question. To what extent will the SOL assessment be shared with the full board?
We will continue with our schedule of sharing, Ms. Smith, in accordance with the accountability plan.
Okay, so we'll get a report out on that assessment?
Yes, ma'am.
Okay.
Yes, ma'am.
So I'd like to table all discussion about SOLs unless it pertains to your vote on whether to accept the in-person learning update for another day. Okay. I know that it's important, but we'll get that information at another time. Okay, Ms. Bassine and then Mr. Clanton.
Thank you. So along the same lines as Ms. Campson's question about substitutes for teachers, I know there have been a lot of questions about substitutes for nurses. And I know that that is, I know that that's pretty tight. Similar situation with teachers, where we have with nurses as well. Could this be an opportunity though, where, we kind of, partner with some of our community partners to help. And I mean, like, the Medical Reserve Corps, for instance, with the health department, who I know right now have been working tirelessly to vaccinate the community. But, if we need, in any emergency situations in the school buildings, if we could, just kind of keep that in the back of our minds of how we might partner with other institutions to, build a reserve corps of nurses, because, this is going to be with us. This virus is going to be with us for some time. And so I just want to keep that in the back of our minds too.
Yes.
Yeah.
And you're absolutely correct. We have a very small pool of substitute nurses, and I think you and I had a discussion why that might be. But yes, and so if we have a nurse for whatever reason who has to quarantine or is sick, we have to make internal arrangements as we've always done. We have an outstanding nurse supervisor, Shelley Lewis, who does a great job in filling in where she's needed and calling on community partners when we need additional support. So we will continue to do that, and we are certainly open to additional partnerships.
Great, thank you.
Okay. Thanks, Mr. Steen. Okay, Mr. Clinton, go ahead.
All right, thank you, Dr. Martin. Quick question. I wanted to go back when I was thinking about on the schedule. I was looking back here on March 1st. All teachers are coming back in the buildings, right?
All teachers and staff, everyone.
Got it. So everybody's coming in there. So
right.
would that also be safe to assume that that means that our teachers are going to be teaching from their classrooms?
That is a great assumption. They will be teaching from their classrooms.
Got it. So I guess this is where some of that kind of driving the car and changing the tire at the same time is going to occur.
Right.
In the classroom.
That's right.
This will be the first time that many of them are back, then they may have set up situations at home. But then also I want to make sure, and I guess, Dr. Cataldo may be, but that the Wi-Fi and the internet connectivity within the classrooms are up to par. And I take it that we're anticipating that for their return as well, right?
Yes, that is currently being reviewed. And quite honestly, Mr. Clinton, we're going to have to ask for flexibility there, because we know there at times we're going to have some connectivity issues just because we do during a normal school year. Yeah. So, certainly Dr. Cataldo and his team continue to work on our infrastructure and making sure that, there are fewer issues in that area.
Yeah, got it. The other piece follow up to that was actually to Ms. Matthews. I know that we're updating a website, but has there been any consideration, and I know you just got here, but any consideration about the possibility because of an app, an NPS app? Many of the individuals do their communications on their phone. And, if there's just, now or down the road, a way of being able to push information out and even some of these surveys and things directly to the phone. I see you shaking that head. So that one. And I saw on the learning loss considerations, are we also looking at some credit recovery options? And I mean, we can get into the details of that next month, but definitely on our high school, attendance and making sure that we continue to make sure our seniors and high school students are graduating and matriculating on time, just to make sure we got some credit recovery. So I see shaking of the head there. Okay.
Yeah, so Mr. Clinton, we can't wait until the end of the school year to start, worrying about credit recovery. That's something we have to do continuously throughout the school year. Our guidance counselors and graduation coaches work very closely with our kids. Again, every child in every building has a plan. So we know where those children are and what supports they need, if they need grad point or what other support. So this is not something that we wait to fix at the end of the school year. This is something that we're reviewing constantly to make sure that our children graduate on time.
Appreciate it. Thank you. Thanks, Dr. Martin.
Mm-hmm. All right, Ms. Basine, we think you're done and then you're not. No, just kidding.
You can cut me off.
No.
Thank you again. So, this is a great conversation, and the questions raised by my colleagues are, spurring other thoughts in my mind. So just like, our teachers returning to the building for the first time, our students are obviously also returning to the schools for the first time in a year. And aside from the academic needs, the social and emotional needs will be significant, and will be I know a priority. And I appreciated last month, or the last meeting, where we received the update on the social and emotional learning plan. And I anticipate that will be ready, geared up, ready for our students when we return in person, and also available for our virtual learners at home. And am I right to assume?
Yes, you are right.
Yeah.
All of our children.
All of our children. Okay.
Mm-hmm.
Yeah, and one of the pieces of feedback, that I have received, I know all of us have probably received, feedback from our families about this social isolation felt, among our students, even particularly among our high school students. And, so I wonder, how we can strengthen opportunities for them, even as they do choose to remain virtual, just something for us to think about, like how can we strengthen opportunities, particularly as the weather improves, so that there is some interaction, because families may be weighing, the risk benefits of, it being in person, and their own personal health risks. And, I just would like that to also be something that we're thinking about a little, more strongly, like all of us. Just wanted to put that on the table as well.
I appreciate that feedback. And yes, as you've stated, we shared our plan with the board last month, and we're going to continue to strengthen that plan. And in budget discussions within the next few weeks, you'll hear more about that.
Okay, great.
For next school year.
Okay, thank you.
Mr. Jordan, are you ready?
Yes, I am. Thank you. I appreciate the questions that have already been asked and answered. I'm gonna do my best not to repeat any. I'm also thankful for the update. I would like to kind of go back and maybe follow on some of the notes I wrote as Dr. Pohl was presenting. Dr. Pohl, there was at one point on one of the slides, you referenced something about superintendent authority to make some changes, and I didn't catch what you were saying there. Can you repeat that?
Yes, sir. For Dr. Birdsong to have the authority, if there's a classroom or a couple classrooms or even a school that might be affected from COVID-19, that she could have the authority to close that, just a building down or a classroom down for a set period of time to make sure that it doesn't spread. Instead of so we wouldn't have to close the whole division, but the authority just to look locally to classrooms, areas, or schools.
Right. So to say it in my words is to make sure there's flexibility so that if an incident occurred, it can be localized by a classroom or by a school, not resulting in the entire school division shutting down as a result of an incident. Is that correct?
Yes, sir.
Okay. On slide 18, there was back on the 20 student piece where it references, Ms. Tanner, can you go to slide 18, please? Yep. Oh, well, my slide 18 has reduced student count step 1 at the top of it. In any event, yeah, that one there. So can you walk me through this slide again? So where it says reduce student counts, can you describe reduce from what, and then just walk me through this slide again, please?
Absolutely. So the reduced part comes in the hybrid plan option. So in normal circumstances, this teacher would have 20 students in their classroom at a time. However, with the Virtual Scholars Academy and the hybrid option, the maximum this teacher would have in one classroom at a time would be 8 students, so that the social distancing is something that can be kept at the 8 feet or 6 feet social distancing between students and teacher. So that's where this comes into it. The reduced student count is reduced count in the classroom because of the hybrid option.
And the what's identified as the VSA students, that is a different teacher, or is that the same teacher?
So that would be the same teacher. So the concurrent teaching would happen with the hybrid students that are in person, either on Monday, Tuesday, Thursday, Friday, and the VSA students that will remain virtual Monday, Tuesday, Thursday, and Friday.
Okay, so back in October when we got a presentation, you all provided us with a chart that showed, I think, the VSA counts by school. So just so I make sure I'm following again, is it the case that every teacher would have this combination of House A, House B, and VSA students, or is it the case that there are some VSA only teachers?
So there are a very minor few teachers that may only have VSA students. The great majority of our teachers will have House A and House B students at least. And I think it was somewhere over 1,600 of our teachers. I'd have to go back and look at the data. I think it was somewhere over 1,600 of our teachers would have House A, House B, and VSA students in their classroom.
So in this proposal, in the vast majority or overwhelming cases, the teacher that has been teaching these students from day one is the same teacher that would continue to be teaching these students as we phase in for in-person. Is that correct?
Actually, there should be no teacher changes for any student. If a teacher is slated to teach virtually, they will continue to teach virtually because their students were set up that way as well. The minor few. The goal was to have no teacher changes when we transition to in-person learning. The only opportunity where that may happen is if there's a health reason where a teacher may have to stay home, or some other complication, but schedule-wise, they're scheduled to stay with the same teacher.
Okay. Then there was a mention of a transportation stagger change related to Ghent Elementary School. Can you explain that again, please?
I can. So the Ghent Elementary School, we're just asking them to be a little off the stagger since they actually go to school with ADL students. And ADL is on the stagger, the second stagger. So that's where we would want Ghent to be, in a 5-minute variance from that.
Okay. And then on the same topic of the transportation, there was a slide that had, I think it said something about 40, and it also mentioned that this was a decrease. Can you describe that?
I don't think I said
increase ridership.
Yeah, sorry. And yeah, so originally, we were really looking to have our students 6 feet apart on every bus route, but I think when the numbers were crunching and to be able to do a phased in approach with the timeline that we have, I believe Mr. Fraley and his team have looked at numbers, and it's not all buses will be at 40, but there are a couple of bus runs that might have to be upwards of 40, and that would include having students in the same household sharing seats, which is allowable, but it would also include, the 3 feet of distance with masks versus trying to maintain the 6 feet on the buses.
Okay. And maybe a big picture description or further explanation. So and it's Dr. Birdsong, Dr. Pohl, anyone that Dr. Birdsong deems appropriate. So during the early part of the presentation, the issue was raised dealing with the guidance that around the realities of African-American students and families being disproportionately impacted by COVID-19. And so we've also seen in some of the reports that we have reviewed thus far in terms of teacher cohorts, employee cohorts, that there were some cohorts that had slower or reduced response rates compared to others. Can you talk about, from your big picture approach, what intentionality you feel you've built into the recommendation that that addresses the fact that we do have 70% of our school division being students of color, in some schools 80-90% being students of color, and the impact that also is occurring in those communities? Can you speak to it in any particular way of how those concerns and even how we may be seeing responses as far as students that may be choosing to return in person versus being virtual, but just any thoughts or intentionalities you all have had around addressing those concerns?
So Mr. Jordan, I'd like to start by addressing that, your question, and you're absolutely right. And I think all of the research has shown us that in communities of color, a lot of our families are apprehensive about returning our children to schools for in-person instruction for a variety of reasons. We have multi-generations of family members oftentimes living in our homes, and parents are concerned about their children potentially going to school, contracting the virus, bringing it back home, and things of that nature. So we've thought a lot about that. And that's why it is so critically important that we have a robust Virtual Scholars Academy. This instructional programming has to meet the needs of our students. And that's why I believe, in my opinion, have gone above and beyond to provide that professional development for our teachers to ensure that we are able to continue to provide our children with a quality education. We know that our children have needs outside of the classroom, which is why we've been very intentional in our efforts to meet their social emotional needs, which kind of goes back to Mrs. Bassine's question about what are you going to do, if parents decide to keep their children home, and how are we going to meet their social emotional needs? And I think we've done a pretty good job of addressing that. Can we do a better job? There's always room for improvement, but I think we have intentionally ensured that our online program is robust, so that our parents won't feel like just because my child is not in school that they're not getting a quality education. So we put a lot of time, effort, and energy into virtual programming, and I think we're pretty good at it now. We've been at it for a few months. We've had time during the summer to plan. We learned a lot from our mistakes during March of last year when we were required to close all the schools. And so we've given all of that thought. So we need to make sure that, the literature supports right now that a lot of our families of color are not sending children back to school. And so we need to make sure that we're able to provide them a top-notch education online, and we've done that.
Yeah, and just in transparency, I want you to know that I've asked the same thing of the governor and the state superintendent as well, because while I appreciate the letter that the governor provided, I'm appreciative of the fact that this board has made decisions around what we think is best for our students. Whether I've been on the winning side of a vote or not, I'm glad that we've done that. And I think it's important that we continue to do that, and not just find ourselves, being pressured
whether it's from the White House or whether it's from the State House. We always have to be able to do what we think works best for Norfolk students. So I'm going to be posing those same questions to them as well, because I think it's critical. It all goes together. The last comment I just wanted to mention, in the slide that has the summer program and the learning loss piece, I know Dr. Martin requested that we not talk about SOLs and those types of things. I do think that the academic data ties to this. And so, I am supportive of the recommendation. We'll talk about it more in the business meeting, but I don't want it to be perceived. I have a lot of questions and concerns about what it is that this summer programming is involved. So the summer programming piece is more of an informational piece. It's not a part of any recommendation that we're being asked to vote on tonight, correct?
That is correct. We knew that there would be questions about what's going to happen this summer. Maybe that would influence your decision-making around the in-person plan. So we just needed you to have an understanding that we've been planning for summer already. And we're prepared to present that plan to you in an upcoming work session.
Yeah, so moving forward, as you all were very good about providing us with reports on student attendance and who were missing assignments and all those things as we were working through things in the beginning of the year, I would encourage, as part of our transparency plan, that we include that moving forward, so we can make sure that we can monitor how things are going should the board approve the plan as presented.
Yeah.
So I think that is, oh, nope, I got one more thing. Classrooms that may have leaks from the ceiling. Any classrooms that we have that may have trash cans or buckets in them right now, will those classrooms be removed from the count until such times that repairs are made, that we aren't bringing students back to any classroom that has leaks or other health concerns above and beyond the 757 classrooms with the ventilators, or whatever the appropriate terminology that Mr. Fraley used?
So,
sanitizing humidifiers.
Thank you, sanitizing humidifier, not ventilator, please. No, not ventilator.
I apologize if I wasn't clear on that.
No,
they're made by Iono Pure. It's the company we deal with. Yes, sir.
So Mr. Jordan, to your question, so I first of all, and it relates to your previous question as well. Building principals have been working so hard. As you know, they're working hard, and I need to acknowledge all of their hard work. They have, and many of you have had the opportunity to visit schools and classrooms and walk the buildings with them. So you know what they are doing. They have gone above and beyond preparing their schools for the safe return of our children and teachers. So first and foremost, you need to know that, and I need to acknowledge their hard work. So as it relates to children and what we're doing intentionally, our building principals, they know each and every child. And so because they know our children and our families, in addition to what we can offer at the division level, what they're offering is much, much more, because it's where the rubber meets the road, in the schoolhouse, in the classroom. So I'm going to give my principals credit for all of the hard work that they're doing to address social emotional needs, calling parents themselves, picking up parents and taking them, to the drugstore to get items. I mean, they have gone above and beyond, and I need to applaud their efforts. And I know they will continue to address those issues related to social emotional needs and to building leaks in schools. So if there's a classroom and you've just got water pouring all over the place, I just can't imagine that we have a building principal who's not trying to address that. And so, if there are leaks in the building, then that needs to be certainly brought to the attention of the senior custodian at the school, the lead custodian, and we have area supervisors on, up the chain of command to Danny Johnson, to Mr. Fraley. So if there are concerns about leaking classrooms, then we need to know so that we can do something about that.
Yeah, thank you. And I just want to be clear, because I think sometimes I may ask a question and then I get caught in this thing like somehow I'm not acknowledging building principles.
And I wasn't inferring that.
Okay.
I just wanted to make sure that I was intentional about acknowledging their work. That was,
Now, I respect all that they do every day and know how hard they work. My question was really geared towards the support from us, from the board, from central administration, that if the principal finds themselves or has a classroom that has water leaking, or finds a classroom that may have some other health issue, that we are saying that they would be supported if they felt it was necessary to pull that classroom out of circulation, which then could have impact on these other things that you all were talking about. That's what I was trying to make sure we were prepared to do.
And I would expect my team to go in and have the experts do an assessment of what's going on and make sure those issues are addressed.
Thank you.
That would be my expectation, Mr. Jordan.
All right.
Thank you.
Thank you, Dr.
You're welcome.
Ms. Campson, go ahead.
She might be on mute.
She knows.
She is on mute.
Ms. Campson, if you click down on the space bar.
Oh, wait, did that do it?
Yeah, you're on. Go ahead.
Okay, sorry, because something happened to my whole screen.
You're hot, Campson.
Okay. I just had one last thing I'd like to remind everyone of as we move forward. Everything's not going to go perfect, everybody. This is a new experience for all of us with the pandemic, and I hope everyone will take a deep breath as we move forward, our school staff, our parents, and realize that a lot of planning is going into it, but even when that happens, the best plans cannot work out perfect, and to give everyone a little breathing room here. Let principals know if you have a concern once the reopening hopefully gets started, but give them a little, as one of the other board members said to me, a little grace as we move forward, and realize that not everything's going to go perfect to begin with, and we'll just continue to improve. Nothing's carved in stone, as Dr. Birdsong said. And one last thing, Mr. Fraley, the leaky roofs, I'm 100% behind Mr. Jordan on that. Get those roofs, those leaking classrooms fixed. Thank you.
Yeah.
Yes, ma'am, we will.
Thank you, Ms. Campson. Okay, well, in closing, we have experienced that opening a school district after a year of distance learning is a monumental step. And over the past year, we have learned more and more about methods for sustaining a successful educational environment during a pandemic. In all the different types of settings where people come together, schools have been found to be among the safest when mitigation measures such as physical distancing, masking, hand washing, and screening measures are followed. As Dr. Birdsong and her executive leadership continue to diligently monitor community health matrix to make informed decisions, they have the best interest of students and staff in mind. They have listened to community members and adapted their recommendations to provide accommodations to meet the unique needs of many of our families through the hybrid model approach. With a focus on implementing key mitigation strategies, teachers, staff, and students may return to a school with classrooms that have been modified according to the CDC guidelines to provide the safest environment possible. Families have the option to stay the course with distance learning through the Virtual Scholars Program, which will continue to provide the same robust, as Dr. Birdsong said, curriculum as in-person learning. The Norfolk School Board has navigated the past year with a consistent and deliberate direction to provide stability during uncertain times. While the school board's goal is to provide the direction to continue the path forward, it is also important to note that this is a shared responsibility. Our success depends on our community, which is why I'm asking each of my board members in the greater community to be a friend of Norfolk Public Schools. Being a friend means mask up, wash your hands, physically distance, and if we do vote to go back to in-person, please keep your child at home if they are sick. Doing so allows Norfolk Public Schools to continue a safe and supportive academic path forward for our students. So I just want to say that in summary. I think, we've heard bits and pieces of that throughout our discussion. And of course, we'll be voting on this later this evening at our business meeting. So thank you, everyone. I really appreciate, I think we covered our bases once again. And so thank you. All right, Ms. Tanner, next on the agenda, we have our executive session. Could you please read the motion?
Madam Chair,
Yes.
I move that we go into executive session.
Sorry, go ahead.
And I'll second.
Dr. Gabriel, second. Okay, read the motion, please.
Move that members of the school board go into a closed session for the purposes which are set on the subsection A of section 2.2-3711 of the Virginia Freedom of Information Act as amended for discussion or consideration of prospective candidates for employment, assignment, appointment, promotion, performance, demotion, salaries, disciplining, or resignation of specific officers, appointees, or employees of the Norfolk Public Schools pursuant to subsection 1 of the above cited code section. The subject of this portion of the session is the discussion of today's regular personnel agenda, discussion or consideration of disciplinary and any other matters concerning students in Norfolk Public Schools that would involve the disclosure of information contained in a scholastic record pursuant to subsection 2 of the above cited code section. The subject of this section of the session is the discussion of today's regular student support services agenda in consultation with legal counsel and briefing by staff members concerning actual or probable litigation or specific legal matters requiring the provision of legal advice by counsel pursuant to subsection 7 and 8 of the above cited code section. The subjects of this section of the motion are the two set out in subsections A and B above, and legal matters related to the process of reinstating students after a period of long-term suspension for more than 45 school days or a period of expulsion for 365 calendar days where the student is given notice that he may return to a school within the division, either alternative or regular school, during or after the period of suspension or expulsion. Basine?
Aye.
Campson?
Aye.
Clanton?
Aye.
Gabriel? Is she on mute?
Yes, she is.
Gabriel?
Dr. Gabriel, you're on mute.
Okay.
Aye.
Okay. Jordan?
Aye.
Smith? And Martin?
Aye. An executive session. Can I get a motion to come out of closed session, please?
Madam Chair, I move that we exit closed session.
Thank you. And Ms. Smith seconded.
Okay.
Ms. Tanner, please read the resolution.
A resolution certifying an executive meeting of the school board of the city of Norfolk in accordance with the provisions of the Freedom of Information Act. Whereas the school board of the city of Norfolk has convened a closed meeting on this date pursuant to an affirmative vote, recorded vote, and in accordance with the provisions of the Virginia Freedom of Information Act. And whereas section 2.2-3712 of the Code of Virginia requires the certification by the school board of the city of Norfolk that such closed meeting was conducted in conformity with Virginia law. Now therefore it be resolved that the school board of the city of Norfolk hereby certifies that to the best of each member's knowledge, only public business matters lawfully exempted from open meeting requirements by Virginia law were discussed in the executive meeting to which this certification resolution applies, and only such business matters as were identified in the motion convening the executive meeting were heard, discussed, or considered by the school board of the city of Norfolk. Basine?
You're not on mute. I just couldn't hear you.
We're doing the vote. So
She said aye. I know it was very faint. She
did
said
she say
aye.
aye? Oh, okay. I couldn't hear. Campson?
Aye.
Clanton?
Aye.
Gabriel?
Aye.
Jordan?
Aye.
Smith?
Aye.
And Martin?
Aye. Okay, thank you, Ms. Tanner. And we are going to take a 29-minute break. Meet here promptly at 7 to begin our business meeting. Okay, so make the most of it. All right, 7 o'clock, it's time to begin our business meeting. going to call the meeting to order. And Ms. Tanner, please call the roll.
Basine?
Here.
Campson?
Here.
Blanton? Okay. Gabriel?
Present.
Jordan?
Here.
Smith?
Here.
Martin?
Here. Okay, thank you. All right, first on our agenda, we have the Pledge of Allegiance, which will be led by Ms. Georgia Simpson. Oh, I'm sorry, Ms. Amelia Burrs.
Good evening, Madam Chair Dr. Martin, Vice Chair Jordan, Superintendent Dr. Sharon Birdsong, and board members, and our viewers. Please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you.
Thank you. Okay. Up next, we have our student musical performances. Dr. Birdsong, would you like to introduce them?
Good evening, Madam Chair Martin, Mr. Jordan, members of the board, and members of our community. Today we have two wonderful musical performances. We have Kayla Stringer, who is a student at Norview High School, being supported by the orchestra director Kiera Smith. And then we have both choirs from Blake Taylor High School and Norview High School under the direction of Sarah Tillman, Amy Koss, and Paul Zimmerman. So without further ado, Kayla, take it away.
it resound loud as the rolling sea. Sing a song full of the faith that the dark past has taught us. Sing a song full of the hope that the present has brought us. Facing the rising sun of a new day begun. Let us march on till victory is won. God of our weary years, God of our silent tears, thou who hast brought us thus far on the way, thou who hast by thy blood brought us into the light. Keep us forever in the path, we pray. Bless our feet, stray from the places our God where we met thee. Bless our hearts, drunk from the wine of the world, we forget thee. Shadow beneath thy hand, may we forever stand true to our God, true to our native land.
Great job, everyone. That is so exciting. It's very poignant. That song is very poignant, and glad we can enjoy that this evening. So I'd like to start with Ms. Smith, the orchestra director at Northview High School. Would you like to say a few words?
Hello. Yes, good evening, Dr. Birdsong and all of the school board members and administrators. Thank you so much for allowing us to perform for you all. All of the students and Kayla as well worked so hard. Having to do this in a virtual setting provides an extra level of challenge, but they worked so hard and we had a good time as well. So thank you so much for this opportunity.
Yes, thank you. Thank you for all the work that you're doing with these very talented students. It must be a really exciting and rewarding job to have. I'd like to open up to Ms. Sarah Tillman or Amy Kraus or Paul Zimmerman. Would one of you like to speak?
Yes, thank you. Good evening, school board members, Dr. Birdsong and cabinet. I just echo Ms. Smith's statements on the challenge of making music in a virtual setting, but we enjoyed this collaboration between schools. It was exciting. And we hope that you enjoyed that performance. Our students put a lot of their heart and soul into it. And they even created the slideshow. So it was student created slideshow. So again, we thank you very sincerely for the opportunity to allow us to showcase our students at your meeting this evening.
It was our pleasure. And so because things are online, I know there's that technology aspect to it as well. Have you been able to use that to maybe reach a broader audience and do some performances over the past year?
This was our first virtual performance. We have been working on smart music and potentially doing a citywide collaboration project, maybe moving forward in the future, hopefully if that works out. But this was our actual first virtual performance for the school year.
That was excellent. Thank you so much.
Thank
and
you.
I do have a question for Ms. Kayla Stringer, can you tell me about how this year's been going for you and your time practicing or performing with the violin?
Sure. I'm not gonna lie, it's been very stressful. It's definitely different, but as all the students are, we're adapting to this new way of schooling, and I think for the most part, we're taking it really well.
Well, it's beautifully done. So thank you for recording that and coming here and sharing that with us this evening.
Thank you for the opportunity.
Of course, and good luck in the future. All right, so next, let's moving on. We have our superintendent's report. Dr. Birdsong, can you go ahead?
Absolutely. Good evening again, Madam Chair Martin, Vice Chairman Jordan, members of the board, and members of our community. Thank you again for the opportunity to provide a few updates to you this evening. I'm pleased to share a video that captures some of the wonderful things that have recently taken place in our school division. We begin the video with an inside look at the City of Norfolk's vaccination event, in which many of our employees were able to participate during the first week of February. I also had the wonderful opportunity to participate in the vaccination process after the first event took place for our teachers and staff. The event was certainly very well organized, and I dare say that the process was painless. School nurse Erin Sweeney from the Academy of Discovery at Lakewood even described me as the best patient ever. You can see Nurse Sweeney here in the picture administering the vaccine as nurse supervisor. Shelley Lewis offers me some much needed comfort and support. As noted in the video, our school nurses are an integral part of the vaccination process and continue to be vital to executing our health mitigation procedures across the school division. Kudos to our school nurses and Dr. Dennis Moore, Senior Director of Student Wellness, as well as everyone on our student wellness team, and also our athletic trainers for stepping up to assist with these ongoing efforts. Next, you'll see highlights from a few college signing day events that were held for student athletes at Booker T. Washington, Granby, and Norview High Schools. It was a truly proud and emotional occasion for the mighty Bookers as they celebrated 3 of their girls basketball players signing their college commitments. Then we take a look at the deliveries of desks that were built and donated to some of our Title I schools from the CHIP Foundation so that our students could have a comfortable workspace while learning at home. After that, you'll see the teachers of Morey High School getting a nice surprise from the Morey Booster Association, whose members stopped by to drop off lunch as a token of gratitude. And finally, this month is School Board Appreciation Month. So a few of our teachers and students wanted to express their appreciation to each and every one of our illustrious school board members in a bit of a unique way. We hope you will enjoy this special presentation. So let's start with the video.
Norfolk Public Schools and the Norfolk Health Department collaborated to give approximately 2,000 NPS employees their first COVID-19 vaccinations. The successful 3-day clinic was highly organized, and participants felt the event went smoothly and safely.
I felt very comfortable. It was quick, ease of access to the facility. Once I got in, they asked for identification. I provided all of that and went right to the table and got my shot.
Today, in my experience here, I would give them an A+. I just feel like everything's in place. All the tables are numbered, all the people are at their tables, they're spread, social distancing exists, all the floor markings are there. Their recovery area or waiting area has been social distance. They have enough staff here to direct you where you need to go or answer any questions you might have.
It's pretty much as you're coming in, you're met and you're moved right along. It's been a pretty smooth process. There's not even much of they have a waiting area to sit in if it gets backed up, but it's not really. It's they're just sort of flowing through the process, so it's going well.
It wasn't just workers from the health department administering shots. Several NPS nurses were on hand to ensure that their fellow employees got their first dose of the vaccine.
We have been working on the last 2 days, training the Norfolk Public Schools nursing staff to be able to administer the vaccine, and many of them have successfully administered vaccine to the Norfolk Public School staff.
It's been awesome. Virginia Department of Health has been very helpful. The nurses there are helpful. Whenever I volunteer there, they've been great. As far as the vaccination clinic, it's run great. I think they got the vaccines to MPS employees as fast as they could.
On the third day of the clinic, Virginia Governor Ralph Northam visited the site and got a first-hand look at how well everything was going.
Just so proud of the team effort in this with the health department, Norfolk City Schools, the volunteers, the nurses that are here to help administer the vaccinations. And, I've had the opportunity to talk to a number of the individuals that came in for their first vaccine, and they're enthusiastic, they're very appreciative, and this is what we need to do to, work together to get Virginians vaccinated so we can get back to our normal lives. So it's been a great day, and it's good to see everybody working together.
Although there have been no athletic games so far this school year, that hasn't stopped some of our student athletes from achieving their hopes and dreams. At Granby High, 2 members of the soccer team, Alora Grohowski and Lilianas Aragoyan, signed with the University of Lynchburg.
I wasn't really expecting going there at first because it's a small school and I didn't really want at first to go to small school, but I actually went to their ID camp and I really liked the campus and I love the coaches and like the team, and that was really like it for me. So I was like, okay, I want to go to Lynchburg.
Grohowski has enjoyed her Granby experience.
Academically, I definitely enjoyed all my classes. I really liked all my teachers. Academically, I had a really good time. And athletically, though most of my recruiting came from my club team, Granby definitely helped, and it was a lot of fun. It was more of the fun side of soccer rather than the super serious, and it was just fun to play.
Maggie Pittman will play volleyball at York College in Pennsylvania. She, too, is thankful for what Granby has done.
I'd say taking part in the varsity volleyball program here, as well as the IB program, has definitely helped me prepare my time management skills and really taught me to be on top of my work, which I think is something very important that I will definitely be able to take into college that I've learned at Granby, or through Granby.
Booker T. Washington's girls basketball team had 3 players signed during an emotional day. Amaya Jordan and Jamia Britt committed to Mary Baldwin University. For Jordan, taking a visit on campus sold her on becoming a fighting squirrel.
Yeah, we went and visited in person, and we got to feel we seen all the teammates, and he showed us around the schools, everything. And he told us what programs we would be interested in our careers and stuff like that.
As for Britt, she appreciates Booker T's role in helping her.
All of my teachers have been very helpful throughout the process. I've always been a student athlete, so grades haven't really been a problem. And then the coaches, Coach Bryant basically put me out there so I could get recognized by Mary Baldwin.
Natalia Collier will take her talents to Virginia Wesleyan. She says it's been a long journey, but she is grateful.
I was emotional because it's I've been through so much. I came from the 804 my sophomore year, transferred to Lake Teller, and everything didn't go as planned. So I transferred to Booker T, and unfortunately I didn't get to play, but I know that I'm family here. And it's just been a real rocky ride for me. So I'm just happy to be in this position I'm in, no matter if it's where people thought I would be or not, but I'm just happy I had this opportunity to play at the next level.
Over at Norview, Donovan Everett, a defensive end, will continue his football at the Naval Academy.
So I felt like the Naval Academy was the best decision for me because I want to be set up after football. Football doesn't last forever. The career span in the NFL is only 3 years, so I want to be able to do something after football.
Congrats to all.
Students from several of our elementary schools now have desks they can use at home, thanks to community partners and volunteers who helped build them. The desks were recently delivered to schools that needed them the most.
So this was actually the brainchild of Trish O'Brien from CHIP of Southampton Roads. That's the Children's Health Investment Program. And she initially came to us with an idea for a desk because she wanted to make 200 of them. And so through donations and being recognized by returning the favor, we've raised a lot of money and we have made 2,000 desks to date. It's difficult for kids not to be in classrooms. And so these desks give the kids an opportunity to have a little bit of school in their homes and to propel them to do well.
Maury High School's Booster Association celebrated their teachers' outstanding efforts in meeting the overwhelming demands the pandemic has placed on teaching and learning. Faculty and staff handed out lunches to their teachers and a drive-by pickup at the school to show them how much they are appreciated. Parents and staff also came out to show their support.
Absolutely 100% here to support our teachers and we want to give a shout out to all the teachers everywhere, but especially our Maury High School teachers who were thrown into this situation in March and have risen to the occasion and exceeded it and have done an amazing job teaching our children online.
February is School Board Appreciation Month, and students from our foreign language and English as a second language department would like to thank the school board for all they do.
Madame Gollet's 8th period French 3 class would like to thank the members of the school board for all of their hard work.
Merci pour votre service.
Merci pour votre service.
Merci pour votre service.
Hola y muchas gracias de todos nosotros en el Crossroads. Esta es la clase de Español 1.
Gracias por tus servicios.
Hi, I'm Candice Terramona. I am the ESL teacher here at Taylor Elementary School. I have two students right here with me, Angelin and Laura, and we are going to be demonstrating our thank you signs in Arabic and Malayalam.
This is called Nanni, and it means thanks in our language Malayalam.
This is my sign that says Shukran, and then that's what people Arabic do when they said thank you for this sign.
From Larchmont, we have Pavel and Miroslav, 1st and 5th graders.
We are from the Czech Republic. Děkuji is how we say thank you.
To the school board, we just want to say thank you.
Shukran. Nani.
Merci pour votre service.
Merci.
Merci.
Gracias.
Gracias.
What a wonderful way to show appreciation to our school board for their leadership, advocacy, and support. Our teachers and students have demonstrated that there's so many ways to say thank you, and they certainly capture our sentiments. Board members, I appreciate the opportunity to work alongside and collaboratively with each of you in this rewarding journey of serving our students, families, and community in the great city of Norfolk. This week is also School Board Appreciation Week, or School Board Clerk Appreciation Week. So we are pleased to take a moment to recognize Ms. Karen Tanner for everything she does to keep us organized and on track with all the business of the school board. Ms. Tanner officially became the school board clerk last fall and jumped right in to provide support through a barrage of changes that unexpectedly came our way this school year. Mr. McIntyre, we need your assistance at this time.
And Dr. Birdsong, I actually have a proclamation to read.
Okay. Okay.
So, the proclamation of the Norfolk City Public School Board honoring Ms. Karen Tanner, Norfolk Public School Board Clerk. This week is the VSBA Board of Directors has designated the third week in February as VSBA School Board Clerk Appreciation Week. Therefore, this Norfolk City Public School Board is officially designating the third week in February as School Board Clerk Appreciation Week, and to adopt the following proclamation. Whereas school board clerks in each locality throughout our great Commonwealth of Virginia are appointed by law to fulfill their duties and responsibilities, and whereas school board clerks are responsible for keeping accurate records of the meetings and proceedings of the school board, a record of all receipts and disbursements, and a record of all official acts, and whereas school board clerks perform such other duties in connection with the school business of his or her county or city as may be required by the school board, and whereas the school board clerks maintain frequent contact with the public, including parents, employees, and the media on behalf of the school board and superintendent, and whereas the school board clerks in the performance of their duties are often required to work extra hours attending school board meetings, and whereas school board clerks join with school boards to help ensure that students achieve their highest potential, and whereas school board clerks provide an invaluable service to the school board members and superintendents, the VSBA Board of Directors does hereby recognize the third week of February 2021 as School Board Clerk Appreciation Week in the Commonwealth of Virginia. And whereas the Norfolk City Public School Board joins the VSBA in recognizing the many and varied contributions of school board clerks. Now, therefore, be it resolved that at its meeting on the 17th day of February, the Norfolk City Public School Board also recognizes the third week of February as School Board Appreciation Week in honor of Ms. Karen Tanner and all the wonderful things she's done to support our school board. So thank you, Ms. Tanner.
Thank you. And I just had a proud moment. Merci beaucoup. That was my sister from Maury, her French class. So I was happy to see her in the video telling you all thank you. So, but thank you very much. It's definitely an honor and a privilege to serve the school board. Thank you.
Thanks, Ms. Tanner. Okay. It's been a fun meeting. All right, moving on. We have approval of the consent agenda.
Hold on. I have more recognitions.
Okay. Surprise.
Yes. Again, VSBA recognizes February as School Board Appreciation Month and salutes the service of almost 850 school board members across the state of Virginia with the theme 115 years of providing leadership, advocacy, and support. Our schools posted messages on their marquees to the school board members. I want to show you that real quick. There we go. They wanted to let you all know throughout the city that they appreciated your service. They also put it on their websites for those who didn't have marquees. And we were excited to have Meredith Hobson. We want to give her a special thank you for having her ESL and her foreign language teachers provide a special thank you to the board members. I thought that would be a great, neat way to say thank you to you all. And you all should have received a package in the mail. Dr. Gibson, she's on the call on the Zoom meeting, but you should have gotten your mask, your lanyard, and then also a stylus here so you can open doors with this and other things as an appreciation. So thank you, Dr. Gibson, for looking out for the board and me as well. And again, happy School Board Appreciation Month. Then also for the month of March, we have Music in Our Schools Month, which engages music educators, students, and communities from around the country in promoting the benefits of high quality music education programs in our schools. Then, which you just listened to earlier. Then Youth Art Month celebrates the visual arts. This month provides a medium for recognizing skills developed through visual arts experiences for grades K through 12. And then we have National School Social Work Month. And that is an opportunity for social workers across the country to turn the spotlight on the profession and highlight the important contributions they make to society and our students in the classroom and across the country. And then in March, we have Read Across America Day, which is March 2nd. NEA has sponsored Read Across America Day with an annual emphasis on motivating students to read, thanks to the beloved children's author, Dr. Seuss, whose birthday school districts across the country honor with reading his intriguing stories. And then also School Social Work Week is March 7th through the 13th with the theme, Beacon of Hope, School Social Workers Lighting the Way. Thank you to our school social workers. And last but not least, we have National School Breakfast Week, March 8th through the 12th, with the theme Score Big with School Breakfast. to remind the entire community that the school breakfast provides a healthy and energizing start of the day for Norfolk students. And this concludes my remarks for the month of March recognitions.
Thank you, Ms. Tanner. Okay, let's move on to the approval of the consent agenda. Can I get a motion to approve the consent agenda?
I move to approve the consent agenda.
Thank you, Ms. Smith. Can I get a second?
Second.
Thank you, Dr. Gabriel. Any discussion? Mr. Jordan and Ms. Basine.
Yeah, on the, I just had a question on the payroll report. If I can just get clarification on that. Just wanted to get reminded the item that addresses the transfer of funds dealing with the payroll account. Can you just refresh my memory on what that's all about, please?
Yes, Mr. Jordan, I'll be happy to. Those would be transfers from our regular checking account to the payroll account. It will cover all of the employees' current pay, the withholdings that are paid to, say, the tax authorities or to the retirement fund or anything else that's withheld. So it's the total of the payroll for the month, in this case of January, $18,572,000. We would have transferred from the regular account into the payroll account to cover all of the paychecks and deductions.
Okay, thank you.
Certainly.
All right, and Ms. Basine, go ahead.
Thank you. I had a couple of questions about the minutes that I was wondering if we could pull them and vote on them next month.
Can you be more specific if you have questions about the minutes?
Some consistency in the description of the discussions again. I would just like to see areas where we don't describe, I guess, the full discussion. It's partial discussion in some of those areas. And so I just would like to pull them for further review.
Okay. All right. So will you get with me and Ms. Tanner and we can make a correction and we'll be able to vote for them on the agenda. Dr. Gabriel?
Yes. Dr. Martin, Dr. Birdsong, when were the minutes posted?
They were posted on Friday.
Yeah,
on Friday. So I would just ask my colleague, Ms. Basine, that if you have a question or concern about the minutes, if they're posted on Friday, if you could just bring them to the attention of Dr. Birdsong or Dr. Martin ahead of time, because, I mean, we can pull on them and vote on them separately tonight, or we can pull on them and then, look at them in March. I just don't know why at this time. I would just recommend that you afford the superintendent and the chair. Maybe you did, and maybe I'm misspeaking about this. So you did let them know that you were going to bring this up?
I did let Dr. Martin know, yes.
Okay. So are we removing the minutes and voting on them separately, or are we removing the minutes and just going to pick them back up again in March?
Ms. Basine had called me just before the meeting to say that there were some errors in it. And so I haven't gone, it was just before the meeting. So I haven't been able to go back and see exactly what that was. So we really need to, we've been pulling the minutes most of our meetings but
that's right.
Without being able to review it, I can't really identify what specifically. And so in order to have that time, I think that.
Right. And so I'm just saying, as a courtesy, if we know that documents are posted on a Friday, then review the documents, notify the appropriate person so that way they can be considered appropriately and discussion and meaningful conversation can happen. But when this just seems to be a pattern, and I think that there's a better solution to this. I respect the concern, but I think that there's a better way that we can approach this other than just pulling it from the agenda every time. Thank you.
Okay, Mr. Clinton, did I see your hand?
Okay, sorry, Jacqueline, you want to come on mute? No, I agree. I'm not going to belabor this here. I just think when minutes are posted, they're posted so we can review them. They're not official until we take a vote on them. So any adjustments, changes can be recommended to the superintendent and the chair and the board clerk before we get to here. It just seems like we keep doing this. And again, my colleague has every right to bring, concerns. But I think that we also talked about the board kind of coalescing around what we'd like to see. And I hope that we can kind of clear this up and we can put this in the parking lot as an item that we can talk about through our governance training. But I just think that we want to keep things moving here. We've had a good meeting, so I'm going to continue with that spirit.
Okay, thank you, Mr. Clinton. Mr. Jordan, go ahead.
Yeah, I just want to say I appreciate the support there. Attorney Cloud has provided us with some potential guidance. I agree with Mr. Clanton. It's an opportunity for us to review it. Also, Dr. Gabriel and Ms. Basine. So sometimes that window from Friday is kind of difficult, but I think Mr. Attorney Cloud has helped us with maybe some guidance that we can adopt. And so at a future work session with our governance training, I think we can get a hold of it. So thank you for the consideration. Okay.
So without opposition, I'd like to go ahead and just remove the minutes this time and do better moving forward. And we will revise them, review and revise them, and have them prepared for our March meeting. Okay, any other comments? Okay, so we have the motion to accept the consent agenda without the minutes on the table. Ms. Tanner, can you please call the question?
Basine?
Aye.
Campson?
Aye.
Clanton?
Aye.
Gabriel?
Aye.
Jordan?
Aye.
Smith?
Aye.
Martin?
Aye. Okay, thank you. Okay, so we're now at our decision discussion agenda. We have the monthly financial report. Mr. Jenkins, will you be presenting?
Yes, Dr. Martin, I will. Good evening, Chairwoman Martin, Vice Chairman Jordan, Dr. Birdsong, and members of the school board. Tonight, I will review the January financial report with you. And I think Ms. Tanner is bringing that up now. Thank you. If you can turn to the next page, Ms. Tanner. Okay, during the first 7 months of the year, we collected $164.7 million of general fund revenue. This was 48.8% of our $337 million operating budget. For the same period in the previous year, we collected 51.6% of the budget, and during fiscal 19, 52.8%. So collections are just a bit behind previous years. On the next page, we'll see revenue and spending to date. During the first 6 months of the year, we spent or encumbered $164.7 million, which is 48.8% of the budget. You can see from the chart, we also spent the same amount of money, $164.7 million. So our revenues were almost exactly equal to the expenditures. During the previous 2 years, spending for the first 6 months was 52.6% of the fiscal 2020 budget and 49.9% of the 2019 budget. Turning to page 4, we'll see 2 graphs. As you've seen in the past, the revenue and spending is shown for each month of the year. The current year is displayed through January with red columns. Monthly comparisons of the previous 2 years are shown in blue and orange. The estimate of the monthly expenditures and revenue are in the green background. There is more detailed budget information available starting on page 5. And there were no budget transfers over $50,000 during January. Dr. Martin, that concludes my report. If you other members have questions, I'll be happy to answer. Thank you.
Sorry, I was on mute. Thank you, Mr. Jenkins. I see Ms. Smith's hand. Go ahead, Ms. Smith.
Dr. Martin. Mr. Jenkins, on page 5, can you explain to us the debt service expenditures, and it looks like revenue also?
I certainly. This is, I guess these are just amounts that are in their budget that we neither receive nor pay. There's $3.9 million or $3,980,000 showing in the city appropriation for debt service and also in under expenditures for debt service. This is equal to 2 cents on the real estate taxes that the city has dedicated to the payment of debt service on capital projects for schools. So the city puts it in their budget every year, but we don't actually receive it because the debt payments are made directly by the city. So there's 2 cents on the real estate taxes that the city collects and uses to pay debt service on school improvements that were made in the past.
Do we know the total amount of that debt?
I would have to get back with you on that. I will say that the debt payments do exceed the $3,980,000. But I can get some information for you.
Okay, thank you.
Sure.
And my colleagues may not be as interested as I am in that information.
Go ahead.
I have one more question.
Sorry.
It looks like in my agreement to the condensed version of reports that I didn't take into consideration that we wouldn't see the grants, how we're executing the grants anymore. And I'd like for that to go back in.
Ms. Smith, we typically provide that on a quarterly basis.
Quarterly, okay.
So you'll get another one at the end of March.
Okay, thank you.
Certainly.
Mr. Jordan.
Thank you. On page 9, for let me find it again. Let's see. There was 510 other extracurricular program shows 86.4% availability. And then D66 facility improvement shows 83.1% availability. Can you speak to each of those and why each would be showing, maybe for other extracurricular programs, just kind of remind us what that is. And then for facilities improvements, explain what we're seeing there in light of the work that's been going on. Thank you.
Certainly. First, the other extracurricular programs, those are largely programs that are held after school hours. So it's and the ones that we have were generally in the past, they were being funded from the state remediation funds. So it's additional educational services for students that need additional help. And I would say that this year spending is far below what it normally is, and I think it has a lot to do with the delivery method that we have. I will say that plans, Dr. Paul has plans to address this going into the future, but we have not spent nearly as much on that as we normally would. On the facility improvements, that's a little easier. Those will be for larger projects. It could be. I don't know that I don't know what the specific projects are, but there will be facility improvements or large repairs that are made for specific buildings. Over the weekend, I think we had an issue with the heating system at one of our high schools, so it would be used for things like that. And we do expect that will be spent before the end of the year, or at least purchase orders will be issued for the work.
Is that in that D66? Is that any way tied to the money we got from the city with the SWIFT funds, or is that just some other category for the source?
It's the use is very similar, but it is not tied to the SWIFT program. That is in the separate capital improvement budget. This falls under the operating budget, but it certainly can be used for, I'd say, identical purposes.
Thank you.
Thank you.
Okay, any more comments on the financial report? Okay. Can I get a motion to accept the financial report?
We accept the financial report.
Okay. Dr. Gabriel,
Go ahead, Miss Campson can have it.
Ms. Campson, can you second it?
I'll second the motion.
Okay, thank you. Okay, Ms. Tanner, please call the roll.
Basine?
Aye.
Campson?
Aye.
Clanton?
Aye.
Gabriel?
Aye.
Jordan?
Aye.
Smith?
Aye.
Martin?
Aye. Good. The monthly financial report passes. Okay, next up we have the adoption of the academic calendar for school year 2021-22. Dr. Birdsong?
Thank you, Dr. Martin. So during our most recent work session, Dr. Pohl reviewed the results of the survey that was administered to our stakeholders related to the two options that were provided for our academic calendar from for next school year. And as a result of all of the feedback that we continue to receive, as well as the board's feedback, we decided that it would be pertinent to develop yet another option. And so we wanted to present that option to you today. So Dr. Pohl is prepared to answer any questions that you have about this option. And we are requesting, certainly as noted on the agenda, a vote, if possible, this evening. Dr. Pohl, do you want to point out some of the differences with this calendar based on the feedback we received?
Yes, thank you, Dr. Birdsong, and good evening again, everybody. Based on the feedback we received, as well as your feedback, I just want to overview a few highlights and give you some data from the survey, the second survey we did. So this option 3 had a first day of school for September 8th. There are 10 early release days for students. 1 was added from the other options because we removed the mid-year PD day, and 5 of these are focused on teacher professional development. There are 2 virtual learning days added to this option that are asynchronous. And even with having the 2 asynchronous hours, we still well exceed the 990-hour requirement in the calendar. November 2nd is a teacher work day and the first asynchronous learning day on the calendar for students. Winter break on option 3 was extended to a full 2 weeks again, which was, if you recall, a large base of the comments from the community. So winter break would be December 20th through the 31st. Teacher Records Day was moved to January 31st, again in direct response to the survey comments from the teachers in the community. Spring break remains April 11th through 15th. However, again, based on response from the comments, the Teacher Records Day and Asynchronous Learning Day was moved to April 18th, which followed spring break. And this request was made since spring break is prior to Easter. And then the student's last day was moved up a day to June 16th so that the teacher's last day is June 17th. So they finish on that Friday and there's no requirement to come back for the following Monday. Again, that was a large request in the comments of the first survey. So really this was developed to honor the community's feedback and to give another option based on that. Data, we did send this out for another week opening time for a survey for the calendar options 1, 2, and 3. We had 3,301 responses. Option 1 had a 12.3% rate. Option 2 at 10.03% rate. And option 3 is 79.67% rate of desire. A few of the most notable comments, the most noted comments were really thankful for the division being thoughtful and considering the comments from the first survey and creating a third option. Positive comments about incorporating virtual learning days since the teachers and students are familiar with the format. a desire for a continued full virtual model for students next year really appeared in there. There were a few comments with an option 3 with a start date of September 7th. And then there was a few comments with an option 3 with a start date of September 9th. So those were the major comments that came through out of, I think there are 438 total comments that I had the opportunity to read this morning. So prepared to answer any questions you may have.
Okay. Any questions for Dr. Cole? Can I get a motion to accept the third version of the academic calendar for the school year 2022?
Madam Chair?
Yes.
I move to adopt the option 3 for the 2021 academic school year calendar.
Thank you. Can I get a second?
Second.
Thank you, Dr. Gabriel. Any discussion? Mr. Jordan, and then Ms. Basine, and then Ms. Smith.
Yes, thank you. I just want to say I appreciate all of the hard work that's been done and the surveys that have been done. You know, I would still like to see us consider some type of inclusion in the calendar and the schedule, some options for targeted or limited year-round or more time for some of our students. I was taking a look at the one of the recommendations on the calendar that was coming out of the city of Richmond, and they had identified some of their students that needed additional support, and so they included in their calendar a year-round option, so to speak, for about 5,000 students that they had identified based upon some of the academic performance. So I'm supportive of the work that's been done. I'm not supportive of any of these options because I would prefer that we have an opportunity to take a look at whether or not we could provide some additional learning time beyond whatever proposals come up during the summer. But I am thankful for the work and respectful of whatever decision the board makes. So thank you.
Thank you, Mr. Jordan.
Dr. Martin?
Yeah.
I just wanted to speak to the motion and ask for a point of clarity.
Okay. Go ahead.
So, Mr. Jordan, I want to say that your sentiments was the same thing that I had. I had a question about some additional, kind of laying it out. So my question kind of goes back to the administration here. Are we essentially getting the calendar in place so that we can begin working on that, but that there may be a very strong possibility that when we come back in March with your other proposals, that we may be making some adjustments to that based on the decision of the board in your presentation?
Dr. Birdsong?
So to be clear, the administration will not be recommending any year-round schooling. However, as presented by Dr. Pohl earlier during our presentation, we have expanded some summer learning opportunities for children that have experienced learning loss. We will be presenting those plans to the board. I believe it's during the March work session. And so we are looking at our summer basic skills to expand that. The period of time that has traditionally been offered. And in addition to the Summer Basic Skills program, we will be providing programs of innovation at each school site so that we can provide additional opportunities for children who have experienced some learning loss. Maybe they don't need remediation, but their parents want them to be engaged during the summer, concurrently with our Summer Basic Skills program. And so that's where we are with our planning efforts now. We have not planned to provide year-round schooling.
So, and as a follow-up to that, Dr. Birdsong, are any of your colleagues or fellow school divisions in our area planning to do any year-round schooling?
I'm not aware of that, no. Based on the information I have now and the conversations I've had with my Region 2 colleagues, I'm not aware that any of them will be providing year-round schooling.
Thank you.
Thank you. Ms. Basine, thank you for your patience. Go ahead.
Thank you, Dr. Martin. Yeah, so my thoughts are similar to what Mr. Jordan had just expressed. And as I've said before, and I think I brought it up even last year when we were having this discussion too. I feel like this pandemic has really opened our eyes and has given us opportunities to challenge the status quo. And reimagining the academic calendar is one area that I feel really needs some reimagining. It's a bit archaic. I think there's opportunities, from a social and emotional, from an academic standpoint for our students and for our staff to rethink how we really develop the calendar that's really child-centered and rooted in best practices. And so I too, I'm not going to support this calendar, although I appreciate the hard work. I appreciate all of the feedback that we've received, and I like a lot of the changes that were made in this third version. But I can't say strongly enough how much I would really like to see us be bold in our planning moving forward. So with that, I am going to vote to not support this academic calendar.
Thanks, Ms. Basine. Ms. Smith and Ms. Sampson, and then Ms. Dr. Gabriel.
Thanks, Dr. Martin. I'd also like to say it is clear that a lot of work went into preparing all three of these schedules. I also would like to remind my colleagues a couple of meetings ago where I did ask about year-long schooling, but not just for a focus on year-long schooling, but it could be in the form of extended days, not just an extended hours, I'll say it that way, not just extended days, but it wasn't addressed. Basically, there was a response of it sounds good, but it may not be good. But I don't think as a board, and especially as someone who's a first term, that it was even given the level of attention that it should have been given in order to feel comfortable making an informed decision that one of these is the better way to go. So for that reason, I believe we need to do something more. So for that reason, I'm not supporting either of these three. I feel like it's much of the same.
Oh, sorry, Ms. Smith. I thought you're finished.
I'm sorry, I'm done.
Okay. Dr. Birdsong, do you mind just briefly to serve someone? I'm getting feedback. The extended day services that some of the teachers are providing for those students who need remediation.
Repeat your question, please, because you were kind of going in and out.
Could you just briefly speak to some of the after school remediation that some of the teachers are doing for those who need it?
Yes, when we think about extended day, there are a variety of ways to implement that concept. You can provide academic supports prior to the school day starting. You can also provide additional supports for students, targeted supports for students who need them after the school day has been completed. So that's certainly a way that we could extend the school day for children who need that.
Okay, thank you. Ms. Campson, you were up next, and then Dr. Gabriel. Mr. Clinton, did I see your hand again? Okay.
Thank you, Dr. Martin. First, I'd like to remind everyone that the new summer school schedule, the new envisioned summer school program is being increased by a third from the traditional 4-week summer school to 6 weeks to help extra here. I think it's wonderful that people have some bold ideas that they think, but I think it's something that we need to give a little more time to. If you might want to look back, Norfolk Public Schools did do year-round school. They had, I think, at least three pilot schools. It was unsuccessful. It became very unpopular with parents because mix up the time because you still have to give a certain amount of days for summertime, and that now has to be extended throughout the year. So every 9 weeks goes 6 weeks and then 3 weeks off. So, that's something to look at. So there are a lot of extended days. We've done a lot of extended days in the past, not for academics, to be honest, but to make up school days. And that has been a strain on children. They're tired after a long day to have more time added to it. But those are just superficial things about it. Certainly you can certainly look at it and do some research on it, but to decide it before this calendar's due, I don't know. That seems pretty challenging to me because it's something that needs a lot of research, and maybe a different year-round model would work, but that's something we don't know off the top of our heads. A lot of research went into that last time. I think they prepared for it for a couple of years before they went into those year-round schools, which sounded like such a great idea, but didn't work out as we had hoped. So just something to keep in mind, that these things can't just be popped out, that they have to be researched and modeled and all of those kinds of things as we move forward. And we really need to get our school calendar going. And so our parents and everyone else knows what it is. And 79% of the respondents voted to move with this calendar. And that's something we need to be a little respectful of too, or why else run the surveys. Thank you, Dr. Martin.
Thanks, Ms. And Mr. Jordan and then Ms. Basine.
Thank you, Dr. Martin. I'm reflecting on the training that we had just a little while ago and how we discussed inputs and outputs and student outcomes. And I would just say that as it relates to the student calendar, if we're postulating other options, the center focus needs to come back to how is this going to relate to student outcomes? And the person who is going to give us that information is going to be Dr. Birdsong and her team. We attend training sessions, we go to different seminars and things like that. But ultimately, when we come back and have these discussions about student outcomes, we need to figure out how are we relating these questions, these concerns directly to this effort, because that's where we should be spending our time. So I will be voting in support of this. This is not different than what we have done in years past. And I do agree, we can be bold and we can reconsider the calendar. But at the 11th hour right now, it's not the time to do that. We know that there is, as Dr. Birdsong had said at the beginning of the presentation, there's flexibility here. If we can just adopt this format for right now, we can have the flexibility to add or subtract what we need based on the student needs as we are working towards our shared student outcomes goals. Thank you.
Thank you, Dr. Gabriel. Mr. Jordan and then Ms. Basine.
Yeah, I just wanted to just to clarify. So I don't disagree what's been said. I'm familiar with the year-round programs that we've had in the past and the evaluations that went on with that. When we were discussing the calendar at the work session, I raised these same things then because and this, I'm not casting any blame on anybody. I'm just simply expressing my own view on this, that I am focused on student outcomes. And I think we do have data that suggests that we may have some students that could benefit from more time. And Dr. Gabriel, as we worked on, forgot what the chart was called, but you can recall
Master Milestones.
Master Milestones. There
Dr. Stewart, I know exactly where you're going with this. Yes.
So we talked about more time and prioritize that and so forth. All I'm just simply raising is my understanding that one of the reasons that we moved the calendar up was because of the concerns around synergy. So I support those decisions that need to be made around the operationalized information that we get around synergy. But I raised at the work session, and I just wanted to share with the board again that even if we lock in this calendar, I think as a board, we should have the opportunity to review and get updates, which I know we will, on the academic data. And I just mentioned the Richmond model, which I will email to you all. I only saw it a couple of days ago. Because I think they found a way to target some students, provide some opportunities, paid teachers accordingly that were willing to work the sessions and tied it to student outcomes. And they were strategic in a target group that they felt that needed it, and with resources that were with the target group limited, so they could also afford what they did. And that's what I was just simply bringing to the board for consideration moving forward. Thank you.
Thank you, Mr. Jordan. Ms. Basine, go ahead.
I don't really have all that much to add, except for respectfully, I've shared this position a number of times. So respectfully, you know, I'm entitled to my view and my vote, and I'm plan to use it. So thank you.
Okay, thank you, Ms. Basine. Let's see. Okay, Ms. Tanner, I think we've exhausted the comments. Can you please call the roll?
Ms. Basine?
Nay.
Campson?
Yes.
Clanton?
Aye.
Gabriel?
Aye.
Jordan?
Nay.
Smith?
No.
Martin?
Aye. Okay. All right, next we have 6.03, approval of the policy FFA, naming school facilities. We discussed this at our retreat, and the recommendation from the policy was to proceed without change. And so can I get a motion to accept the approval of FAA without change?
I move that we accept approval of policy FFA as presented.
Do we have a second?
Second that motion.
Second by Ms. Basine. Okay, I'll open it up for comment. Ms. Campson, go ahead.
I brought this up at the retreat also. I have a concern about naming our schools again after more people. I think it's a divisive issue. It's divisive right now as we look at trying to get the names off of schools because it's become a divisive thing. So we remove those names, and I'm certainly in favor. I don't have any problem with that. I don't understand all the naming of buildings anyway after people because times change. But if we then turn around and take and rename them by another person, about another person down the road, it could be the same thing again. I think it's divisive. I think schools should be named after the neighborhoods and the environments and the places that they are. Until I came here, I never, as I was growing up, and we lived in 3 different places, 3 different states, never was in a school that was named after a person. And I think now we're seeing why, because it's such a divisive issue. So for that reason and that reason only, I will be voting against this.
Okay, thank you, Ms. Campson. Dr. Birdsong, did I see your hand up?
So yes, you did, and I decided to put it down. I just had a thought about if we have this existing policy, and this may be a question for Mr. Cloud. I'm not sure that we need to vote on the policy if it's already been adopted as written. So respectfully, Mr. Cloud may need to address that.
I would agree. If the policy isn't being changed, then it already was adopted by the board. There's really nothing to do.
Okay, well, I was under the impression that we complete the process, that we want to show support of the policy committee's recommendation.
So there, Madam Chair, if I may. I mean, I totally agree with Mr. Cloud in respect that we're not changing it, but there's nothing that stops the board from making a symbolic vote at this particular junction to say that we support the current policy in place.
No, that's true. You can make a motion to that effect.
Yeah.
Which was. Okay, any more discussion before we call the question? All right, Ms. Tanner, go ahead.
Basine?
Aye.
Campson? Clanton?
Aye.
Gabriel?
Aye.
Jordan?
Aye.
Smith?
Aye.
Mark?
Aye. Okay, the policy remains the same. All right, moving on. The next item, we have 6.04 NPS return to in-person learning update. Can I get a motion to accept the presentation, the plans to return to in-person learning in a hybrid environment that we discussed earlier today at our workshop?
I move that we accept the updated plan that Dr. Birdsong and her team presented it to us at the workshop a little earlier today.
Thanks, Ms. Campson. Can I get a second? Mr. Santner,
I'm sorry, Dr. Martin.
Yes.
Before we get too deep into this, since we had the workshop, is it possible to see if Dr. Birdsong and administration has any adjustments or any additional recommendations they would like us to consider following the workshop before we go forward?
Okay, we'll pause this. Dr. Birdsong, go ahead. Do you have anything to add?
Thank you, Madam Chair Martin. And so if the board decides to move in the direction of accepting this proposal, I would need my teachers to have at least 2 additional days for planning so they can actually set up their classrooms and prepare for concurrent teaching. And with that said, again, if the proposal is approved, I'd like to offer March the 1st and the 2nd as the 2 days for this asynchronous planning. That would be the first 2 days that they are that they have to return to the school buildings.
Okay. Okay, so wait, let me regroup. Okay, so let's rescind that motion because now we want a motion that it includes the 2 asynchronous days. Okay.
I make the motion that we accept the updated plan that Dr. Birdsong and her team presented to us with the addition of the 2 extra days starting March 1st, I think, and March 2nd, so that they are able to get their classes ready. Is that all the pieces that you needed?
So, Mr. Clinton, I see you squirming.
I think that it needs a little bit more detail because there were some other
Okay.
things that were not written in the presentation that came out in the presentation. One of those things being the authority for the superintendent to close schools as deemed necessary and to have flexibility with that one. So if my colleague would mind, I'd like to present a counter motion.
That would be great. Thank you.
Keep this clean.
I'm working on making these motions, but I'm not Carlos Clanton. I can't just pop them out of the air like that.
No, I was working on this one too. So I like to, I move to adopt the NPS Return to In-Person Learning Plan with a March 1st, 2021 start date as presented by the administration with March 1st and 2nd deemed as asynchronous days. As outlined on page 16 of the presentation. Further, the plan presented to the board on Wednesday, February 17th, 2021 will replace all prior plans adopted by the board. And further, the board grants the authority of flexibility to the superintendent to make changes to the phases as needed and to close schools as deems appropriate to mitigate potential virus spread. Move by myself.
Second.
Lauren seconded.
Oh, was that okay? Did I have enough detail in that one?
Okay. All right, we're going to open up for discussion. Ms. Basine, lead us off.
Thank you. So during the discussion, the earlier discussion and presentation, we talked about developing a dashboard that would reflect, the air quality or allowing the administration to determine how the building assessments could be publicly displayed, on a dashboard, as well as the case counts for students and staff, having a dashboard around that. So I don't know if we want to address that in a separate motion, but I want to make sure that that is included or covered.
Okay.
I would.
I'm okay with either way. So.
I thought we in our discussion, Madam Chair, I thought we asked the superintendent to come back with some additional information. I support what Ms. Basine's asking. I just don't know if we want to add it in this one.
Okay, let's put it separately. So Ms. Basine, can you make a motion once we vote on what's here.
Okay.
Any more discussion?
I just had a point of clarification on the from what Dr. Birdsong had offered to us on the 1st and the 2nd. Is the 2nd another vaccination event for the district? And if so, would that pose a problem?
So we're not scheduled for any additional events that I'm aware of. At this point, individual staff members are being contacted about scheduling their appointments through the Department of Public Health.
Got it. So if we do have teachers that have vaccinations that are scheduled for their 2nd shots on the 2nd, we will handle that how?
Well, we would certainly allow them that time to be vaccinated.
Okay.
Yes, without question.
Okay.
Ms. Basine?
Yeah, can you also clarify, another point of clarification is, will asynchronous Wednesday, it's still, I saw it's still included, but
that's right.
How will our teachers operate? Will they be are they expected to be in the school building that day? Because I know it's a deep cleaning day. Are they expected to be in the school building, or will they be working asynchronously at home?
The plan is at this time for teachers to be working in the school buildings.
Okay. Every for five days.
Yes.
Yeah. Okay. Thank you for that.
You're welcome.
All right, Mr. Jordan, go ahead.
Please forgive me if I'm requiring you to repeat something that you just said, because I just caught the tail end of it. But on with the phase-in proposal, so all teachers come back on March 1st, but then the high school students don't roll in until
the 26th
of April. Is there any particular reason why you need the high school students the high school teachers to come in on March 1st, if basically 6 or 7 weeks later, they would then be prepared to teach? Is there any potential flexibility in them coming in later, since they would have to serve students later? Can you just speak to that for me, just clarify it?
Sure. We thought through those pieces, Mr. Jordan, and our children with disabilities and in self-contained situations are returning on the 15th in accordance with this plan. And so they have high school teachers, as well as our English learners. They have high school teachers, and we just need everyone to come back and be prepared for our children.
Thank you.
Dr. Gabriel?
Thank you, Dr. Martin. Dr. Birdsong, just a couple of clarifying questions and then a comment. There are some teachers that are scheduled to get their 2nd vaccine during the time of returning for the March 1st and 2nd period. And so while I think that it is a very wonderful idea to allow the teachers the 1st and 2nd time to plan for their classroom, would the administration consider giving any extra thought to the teachers that are getting their 2nd vaccine, just in case? Usually with the 2nd dose, you do feel a little bit ill afterwards. Would you all be open to that discussion? I know that I'm gonna support this plan. But with that in mind, just a little bit of some thought of consideration for that, since there's probably going to be a large percentage of teachers getting their 2nd vaccine at that time.
So to be clear, you're asking, is this the question that I believe Mr. Clanton asked about being flexible with teachers if they have their 2nd dose during that time? Yeah. So repeat your question.
I'll do that. It is very generous of you to give the teachers the 1st and 2nd day of March to plan for coming back. I think that's wonderful, very well deserved. However, there are teachers that are already scheduled to be getting their vaccine at that time, and the division has allowed them the time off to go and get that vaccine. since they're already going to be getting their vaccine on that day, and that would be considered a planning day for them to be setting up their classroom, is there an opportunity for them to have any additional time for them to be working in their classroom, being that they will be receiving their second vaccine at that time?
So,
and you don't have to answer that right now. It's just a thought for consideration.
Sounds very similar to what Mr. Clanton said to me.
Okay, it's fine. I don't have to further the question. But just a comment, just to say that I think that our division has come a long way with regards to the virtual learning process. I've always thought of this as a marathon for our division. I'm very supportive of the actions that we have taken thus far. I applaud our efforts of keeping our staff and our families very safe. I know that has been on the forefront of all of our decision making, especially since we are fully aware of the community that we serve. And I do think that now is the appropriate time for us to take that first step back into the in-person hybrid learning environment. And we will have to be flexible with one another. Dr. Martin, I really appreciated your comments when you mentioned the community playing their part, not sending children to school if they're not well, keeping social functions at a minimum, because what we do know from the data is that while the emission and transmission of the virus is very low in schools, where does it come in from? It will come in from the community. And so it really takes everybody doing their part. And so I will be supportive, I will be flexible, and I will be very understanding if we need to make course adjustments as we go along. And so I will be voting in support of this plan. I believe it is safe and the right thing to do at this time.
Thank you, Dr. Gabriel. Ms. Smith, did I see your hand up? No? Okay, Ms. Campson, go ahead.
Oh, this is just a quick question for clarification from me with Dr. Birdsong. On the asynchronous Wednesdays, are the teachers in the building or out? Because I thought that was the reason we split it with the Wednesday in the middle was because that was cleaning day. Does the cleaning take effect with the staff there, or are they working from home on those days? On just the Wednesdays, I'm not talking about the 2 days that you generously are giving them to get their room set up. But on Wednesdays, for some reason, I was thinking that it was cleaning day too. Once school gets started, like it'll start on the 15th for elementary.
Our custodians clean the building 5 days a week.
Oh, okay.
Our buildings are sanitized daily.
So they're able to do all that within them. Okay. I guess they are, because I ran into that guy at one of the schools today with his sprayer. So that was what he was doing. Okay. Thank you.
Wednesday,
You're welcome.
So maybe he caught you. Just kidding. All right, Ms. Basine, go ahead. Go ahead.
Since we have the motion on the floor, I do feel strongly about amending the motion. So I'd like to offer an amendment to that motion to include direction to the superintendent to establish dashboards reflecting school-by-school ventilation information and case counts among students and staff. So that ventilation information, she can go back with her team and kind of determine what that is. It's broad enough to allow, for her and her team to, decide how to report that information while still giving the direction to establish the dashboards.
Okay.
So, Madam Chair, with all due respect, I'm going to call a point of order on my colleague's motion. Though they are talking about similarly the same thing, they're two separate things. We're talking about a plan for reopening. The dashboard would only talk about strategies of things that have been done to the actual building. So they're two separate things. And so I again ask my colleague I will definitely support a second separate motion just to get this one off the table and then make another motion.
Okay. Ms. Basine, is that okay if we do it that way, if we have them separate?
Yes.
Okay. All right. Mr. Jordan, did you have something to add?
No, I was going to second Ms. Basine's motion, but I accept
Yeah.
and support and doing it separately. So thank you.
Okay, good. All right. I don't see any other hands. Okay, Ms. Tanner, please call a question.
Basine,
Aye.
Campson,
Aye.
Clanton,
Aye.
Gabriel,
Aye.
Jordan,
Aye.
Smith,
Aye.
Mark.
Aye. Round of applause for everyone. It took a lot to get here. Yay! All right, major steps. Okay, so can I, Tanya, please read your motion. Ms.
Okay.
Basine, sorry, Ms. Basine, please.
I move to direct the superintendent to establish dashboards reflecting school by school ventilation information and case counts among students and staff.
Can I get a second?
Second.
Mr. Jordan seconded. Okay, I'll open up for discussion. Questions? Dr. Gabriel?
Thank you. I can understand the request by Ms. Basine, and this is certainly a point that has been brought up by several board members. In fact, in our facilities meeting, we discussed ventilation systems and accountability on a regular basis. However, I'm not prepared to vote on this motion right now because I think that we need to further hear from the superintendent and understand what it is that we're asking. There is a lot that is being requested at this time. And while I think it's important and I am 100% in support of transparency to our community, I think the focus right now is bringing the children back in school and focusing the attention on that. And then we can reassess and develop this dashboard with the ventilation and the air metrics and everything else that, we would want to go into it. But I still do not feel comfortable around exactly what it is that we are directing the superintendent to do at this time with regards to the ventilation aspect of it. Thank you.
Let's get some clarification because I believe that it was up to Dr. Birdsong to come back with a plan on how she would build this transparency and communication around these items. Yes? Yeah. Okay. Mr. Jordan, I think I saw your hand up.
Sorry, I was going to say what you just said, Dr. Martin. I also know that the issue of the dashboard has come up several times. There have been examples shared, Philadelphia, other best practices of examples around the country. And I think just as we were able to create a dashboard that shows our metrics when we voted on our previous phase-in plan, I have confidence that Dr. Birdsong and her team can come back with some dashboard recommendations that speak to the transparency that we talked about earlier today.
Mm-hmm. Okay. All right, Dr. Gabriel, go ahead.
So I'm comfortable with that then. So what we're saying is that we're going to vote on this motion to direct her to just give her the autonomy of creating this concept of identifying ventilation items and the case number by schools, which that's not a very big deal. And then she's going to just come back to us and give us the input from the administration. I just want to be clear on what it is that we are asking and what it is that I am going to be voting on right now.
Ms. Basine, go ahead.
So I'm trying not to be too prescriptive in what that building assessment report would look like, but we know that there are CDC guidelines, there are recommendations around standards in terms of air quality, the number of air changes per hour, and I cannot speak to what has been assessed, which is why I'm, directing or allowing Dr. Birdsong and her team to come back to us to tell us. But I get calls almost every day about ventilation in their school buildings. And as far as, yes, we could focus on the focus should be on returning children to school. But if we want to get the buy-in and the trust of our parents and our teachers, I mean, this is critically important. Every single day, I get at least one phone call or email around this issue. And I think it's really, it's just imperative that we do something. And I know that our administration is working hard. I know the experts have reviewed our buildings, no doubt about that. But, I want it to be where families can just easily go to, this dashboard, click on their school. They can see and have the comfort of knowing what we know, that our buildings are ready to receive students. And so that's what I'm asking for.
Okay, thank you, Ms. Basine. Mr. Clanton?
Thank you, Dr. Martin. This is one of those items that I actually agree with Ms. Basine on. Not saying we don't disagree on a whole lot of things, but I agree. I have said that any plan or any actions that we do, we get one chance to do this thing right in reopening and bringing our students back in, and that any plan that we do has to be transparent. We have to keep equity at the forefront, and most importantly, we got to build the public's trust. And so any information that we have, like we give out these numbers weekly anyway, to the media and so forth. And so being able to make it transparent and clear, and not being so restrictive to the superintendent saying this is how you need to do it. I think you've given some great examples of how other districts are doing it. I think that we have a capable administration. We're just simply saying that this is something we'd like to have added to help build public trust and be transparent, and allow the administration to come back to us, and not have them running all around. I think that once the administration comes back and gives us something that meets those criteria, that's when we have to, as a board, show restraint and not nitpick it. But we need to just be able to say, okay, thank you, this meets the point, and be able to keep moving forward. So if we're just keeping it high level and giving direction, I'm voting yes.
All right. Okay. Ms. Tanner, please call the question.
Basine.
Aye.
Campson.
Aye.
Clanton.
Aye.
Gabriel. Gabriel. Okay, I can't hear you. Okay, so you say aye. Jordan.
Aye.
Smith.
Aye.
Martin.
Aye. All right. Thank you, everyone. This is a very good discussion and good call. Okay. Next, 6.05 matters to the board. I'd like to start with our student representative, Ms. Georgia Simpson. Do you have anything to share with us today?
I do. Thank you.
Mm-hmm. Go ahead.
Sorry. Okay, I would like to take this time to reflect on some of the hardships and joys of remote learning. But before I begin, I want to express that these thoughts are representative of my personal experience with virtual learning. I appreciate the opportunity to share these remarks this evening and hope that my peers will also have opportunities to share their experiences within their own school communities as well. This school year has brought on a strange sadness. Canvas has replaced the traditional classroom, and Zoom has become second nature. While students once entered loud and lively school buildings each morning, we now sit alone behind a screen, often in a dark room. For many students, these adaptations to online learning have brought on loneliness and a longing for the camaraderie and education we left behind in March. The impacts of remote learning on mental health are ongoing struggles in many students' lives. Additionally, young students who cannot yet read or write must rely heavily on parental supervision and support in order to attend online classes and learn critical information pivotal to their development and success as a student. These difficult adjustments have completely reshaped the way we learn. While we are still facing these same challenges, the online learning platform has allowed for unique educational experiences that may have gone undiscovered had we encountered a typical school year. Many students, for the first time, are able to easily express the accommodations they need. Our teachers work tirelessly to ensure that they are both approachable and accessible for each and every student. It is, in fact, our teachers' unwavering commitment to students that has allowed for such a successful online learning experience. This year, teachers have truly proven their ability to reach students, even from a distance. All in all, the highs and lows faced during these challenging times have forever changed us, as well as public education as we know it. My hope is that as we prepare for a safe return to in-person learning instruction following tonight's vote, we can take what we've learned over this last year and apply it to where we're headed next. Doing so will allow us to carry on all that we have learned, which will help us create an even better learning environment that truly meets the needs of all students. Thank you.
Thank you, Ms. Simpson. I really appreciate your thoughtfulness and your comments. Okay. Any questions for Ms. Simpson? Okay. Thank you. Okay. Next, we have our board committee reports. Who would like to report? Any reports on board committee reports? Ms. Smith, go ahead. And then Mr. Clinton.
Thank you. So I'm going to report on the facilities committee, and I'm going to expand beyond that a little bit. So now that we've had that presentation from Cooperative Strategies, Dr. Martin and Mr. Jordan, I think that the board needs to move in the direction of discussing educational planning along with facilities from a perspective of not only maximizing capacity, turning over buildings, diversity, as well as programs. Mr. Fraley and his staff, they do have an itemized list of major projects, but I think we owe it to them as a board to help them not only prioritize what it is that they're doing, but affording them to be able to maximize the limited resources that they have. And after looking at that educational planning presentation, I think it was last week, where we have considerable underutilization. And I think we need to start now looking at our district from a holistic perspective so that we can maximize our dollars more and operate a little more efficiently. Just some of the things that I saw, it was like, to me, we have to be mindful where we spend money when we see on repairs and maintenance, when we see that some areas or schools, there's the potential to be consolidated. So why would we spend money making major repairs when we come back in a year or two later or next year? You follow what I'm saying? I think we need to create an overall plan that's going to help these guys or that team to be more efficient.
So Ms. Smith, as I'm listening to you, I'm trying to think of a way to bring this up to the governance level, because it's not particularly, our job to make a plan. But I think that we need to work on what our ask really is so that we can get a broad view.
Well, it is our job to, how do I want to say it? To deal with the diversity of the schools, the capacity of the schools, the programs. And in doing that, it's going to, in turn, affect what happens on the other side in terms of maintenance.
Okay. I'd like to talk to you more about, I'm not trying to cut you off in any way, but I think that there, just to try to maybe narrow what your questions are. Is there, I'm having trouble because it seems so broad. I'm not sure that.
Well, it's broad because it's broad because it's more strategic. It's dealing with or addressing how one issue impacts another.
Mhm. That's true. Okay. All right. Well, I'm happy to talk to you more about it.
Fair enough.
Okay. Was it Dr. Gabriel and Ms. Basine? Dr. Gabriel, I'm having trouble hearing you. All right, I'm going to go to Ms. Basine. Okay, Ms. Basine, go ahead.
I was just going to say, I completely understand what Ms. Smith is saying. And I think that, because I absolutely agree that we have to be looking at facilities and educational planning together. And I think that would be part of our strategic planning process too. I think that's where that fits in. I know we're all eager to get that process started, and that's where I see that fitting in, I think, in terms of the facility work. And Dr. Birdsong, like, you correct me if I'm wrong, if you agree with that perspective. But
I was just thinking that.
Yeah.
Yes. All of this work should be, everything that we do should be aligned with our strategic planning efforts. So I definitely agree with that. And I think as soon as we complete the process of establishing those common goals and guardrails, we can move forward with our next steps. Right. In terms of how to operationalize all those things.
Thank you. Dr. Gabriel, I'm checking in with you.
See.
Yeah.
All right, can you hear? Oh, it works now. All right. And I'm sorry, I missed Dr. Birdsong's comments, but I was just going to piggyback on what Ms. Smith was saying. We serve on the facilities committee together, and I can understand her concern about we need to have purposeful investment in our buildings. And if our buildings are not going to be around because we're going to change the direction or the purpose of the building, or not even have it in use because we're going to consolidate, then let's not invest in that building, whether it be roof, windows, etc. And I agree with her. And I think that's where the plan, the grand plan comes in. And I might have missed what Dr. Birdsong or the conversation was earlier about blending the educational program and then the building items all into one piece. And I thought that we got the first glimpse of that when Cooperative Strategies presented their thoughts to us during the retreat. So that's all I was going to say with regards to that.
Okay, so that's where I was kind of a little confused, because what I envision is that the administration would bring the request to us and then we would discuss it and make a decision, not that it would be generated from the board. And so I'm sorry, Ms. Smith, for the misunderstanding. That's what I was trying to, sorry. Mr. Jordan, go ahead.
Yeah, and I desperately want to avoid turning committee reports into long discussion. Mm-hmm. I just wanted to say that the educational planning that we've been doing, both with academics and facilities, is a result of a recommendation that came to the board that the board approved. And what Ms. Smith described is what is supposed to be happening as part of that process. And so we talked about at the retreat that there's a steering committee that'll be working with the community stakeholders that will be involved in that process. But that is exactly what we've been doing and was agreed to by the board. I think as we talked about moving forward in upcoming work sessions, we need to make sure that the work that's coming through the facilities committees is tying to the academic piece of it. But I trust that we will get that together as we move forward with the strategic planning and bring all this work together.
Mm-hmm. Okay, thank you. Any more reports? Okay, all right. Well, thank you all for such a, Dr. Gabriel?
Sorry, I don't have a report. I just wanted to commend the student performances tonight, the musical selections. I was really moved by our violinist and then the group of the student singers. It was beautiful. It is a clear example of the wonderful things that our students are doing each and every day, even though they're not in the buildings, they're still using their talents and their teachers are still connecting with them. And I thought it was just moving, beautiful, and a wonderful representation of the great things that are happening in Norfolk Public Schools. So A+ again to the teachers and to the students and the families that are supporting them.
Absolutely. Ms. Basine and Mr. Jordan, did you still have your hand up? No. Okay. Ms. Basine, go ahead.
Thank you, Dr. Martin. Ms. Simpson's comments tonight and the comments, that she brought forward at the last meeting, just reminded me of some other additional thoughts I had about, the needs of getting a clear understanding of the needs of our students and families. And I know we had previously surveyed our families, and I know we've just disseminated, lots of surveys over the year, but as we continue to plan for the needs of our students, are there plans to redistribute, another survey so that we can, we're continually trying to improve our virtual learning experience for our students. And we know that we may be doing this, well into next year, but is there, I just wanted to put that thought out there. I don't expect a response right now, but her comments, were just so thoughtful. And I appreciate the student perspective that it just makes me think, what more can we do for our students in the virtual learning environment? And I did bring that up earlier, but anyway, I thank her and Ms. Burtz for their comments and input.
Yes.
So I just want to put that thought out there for future consideration.
Yeah, absolutely. It's something to think about moving forward. Okay. Anyone else? All right. Thank you, everyone. Thank you, Dr. Birdsong and leadership team. Thank you for such a great meeting. And so what we're going to do now is I need to get a motion to go into our second executive session.
Okay. I move that we enter into our second closed executive session.
Right.
Second.
Okay, Mr. Jordan seconded. Okay, Ms. Tanner, please read the motion.
Move that the members of the school board go into a closed session for the purposes which are set out in subsection A of section 2.2-3711 of the Virginia Freedom of Information Act as amended for discussion or consideration of prospective candidates for employment, assignment, appointment, promotion, performance, demotion, salaries, disciplining, or resignation of specific officers, appointees, or employees of Norfolk Public Schools pursuant to subsection 1 of the above cited code section. The subject of this portion of the session is the discussion of the superintendent's performance. Basine.
Aye.
Campson.
Aye.
Clanton.
Aye.
Gabriel.
Aye.
Jordan.
Aye.
Smith.
Aye.
Martin.
Aye. Okay, I sent a second link, so you should have that in your inbox, and we will go into the executive session, and then when we come out, we will, of course, vote on the resolution and then adjourn this meeting. Okay, thank you.
I move to come out of closed session.
Thank you.
Second.
Thank you, Dr. Gabriel. Ms. Tanner, can you read the resolution and call the roll?
Yes. A resolution certifying an executive meeting of the school board of the city of Norfolk in accordance with the provisions of the Virginia Freedom of Information Act, whereas the school board of the city of Norfolk has convened a closed meeting on this date pursuant to an affirmative vote, recorded vote, and in accordance with the provisions of the Virginia Freedom of Information Act, and whereas section 2.2-3712 of the Code of Virginia requires a certification by the school board of the city of Norfolk that such closed meeting was conducted in conformity with Virginia law. Now therefore it be resolved that the school board of the city of Norfolk hereby certifies that to the best of each member's knowledge, only public business matters lawfully exempted from open meeting requirements by Virginia law were discussed in the executive meeting to which this certification resolution applies, and only such business public business matters as were identified in the motion convening the executive meeting were heard, discussed, or considered by the school board of the city of Norfolk. Basine?
Aye.
Campson? Clanton?
Aye.
Gabriel?
Aye.
Jordan?
Aye.
Smith?
Aye.
And Martin?
Aye. Okay. Meeting adjourned. Have a good night, everyone.
Aye.